The steel rod entered just below his jaw and stopped 2 centimeters from the artery that keeps a man alive. Nobody moved. 12 doctors, 9 nurses, 1 fully equipped trauma bay, and complete, suffocating silence while a construction worker turned gray on the table and a senior surgeon stood with his hands at his sides, blinking at the monitors like the numbers meant something different than they did. Then a woman nobody had ever paid attention to pushed through the crowd, snapped on a glove, and picked up a scalpel. Her hands didn't shake, not once. And that was the moment everyone in that room realized they had been completely, catastrophically wrong about Nora Callum. If you've never seen a trauma bay turn into a war zone, stay with me, because what happened inside Harrow Peak Medical Center in Tucson, Arizona, on the night of September 14th, was the kind of thing that changes how an entire hospital understands what a nurse actually is. Subscribe to this channel and hit the notification bell so you don't miss the next story, because I promise you, they only get more intense from here. If this one keeps you up tonight, drop a like and tell me in the comments what city and country you're watching from. I want to see exactly how far this story travels. Now let's go back to the beginning, because to understand what Nora did that night, you have to understand what they put her through first. The morning started the way most of Nora Callum's mornings started, inside Harrow Peak, with someone talking over her. She was standing at the nurse's station on the 3rd floor ICU, halfway through her report handoff, when Dr. Marcus Vrell walked past the desk without slowing down, didn't make eye contact, and said to the resident trailing behind him, "Whatever the night shift flagged on bed 7, cancel the renals consult. I already reviewed it. It's not necessary." Nora looked up. "Dr. Vrell, the potassium trend over the last 6 hours has been addressed." He still didn't look at her. "Thank you, Callum." That was it. "Thank you, Callum." The way you'd thank someone for holding an elevator. She watched him walk around the corner and disappear, the resident scurrying after him like a man who'd learned that agreement was faster than thinking. The other nurse at the station, a travel nurse named Petra, who'd only been at Harrow Peak for 3 weeks, leaned over and said quietly, "Does he do that every morning?" "Only when I have something worth saying," Nora said. She went back to her notes. That was the thing people who watched from the outside never quite grasped, how completely ordinary it had become. Not just for Nora, for everyone. Dr. Marcus Vrell had been the attending physician over the ICU-ER interface for 4 years, and in that time he had built a very specific kind of order inside Harrow Peak Medical Center. It wasn't chaotic. It wasn't even visibly abusive, not to people who didn't know what to look for. It was just a system in which certain voices carried weight, and certain voices didn't, and the weight distribution had nothing to do with who was right. Nora had been an ICU nurse at Harrow Peak for 3 years. Before that, she'd worked 18 months at a regional trauma center in New Mexico, and before that, was a chapter she kept filed away in a place she didn't open often. On paper, she was competent, reliable, good with families. The kind of charge nurses requested for complicated patients because she didn't rattle and she didn't complain, and she always showed up. What she was not, inside this hospital, was listened to. Vrell had established that early. 6 weeks into her tenure, she had flagged a medication dosing error on a post-surgical patient. A small thing, the kind of thing that mattered enormously, and he had reviewed it, determined she was incorrect, and documented the interaction in a way that made her look like an over-eager new hire who didn't understand attending-level decision-making. 3 months later, she'd raised a concern about a patient's deteriorating respiratory status during Vrell's rounds. He had, in front of 2 residents and a medical student, said the words, "Callum, I understand you're trying to be thorough, but there's a reason we separate clinical judgment from bedside observation. Let the physicians do the judging." She hadn't argued. She'd written it down, the way she wrote everything down, and she'd gone back to work. The patient had been moved to a higher level of care 6 hours later, exactly as she'd predicted. Nobody mentioned it. This particular Tuesday started with a 12-hour shift, a full ICU census, and a staffing shortage that had already burned through the department's overtime allocation for the month. Nora had 3 patients in the morning, 2 post-op abdominals, and a 63-year-old with acute respiratory failure, whose oxygen requirements kept climbing in a ways that made her uneasy. She'd documented her concerns. She'd flagged the numbers to the overnight resident, who'd communicated them upward, where they had apparently dissolved into the general atmosphere. By 9:30, she was rechecking ventilator settings on bed 4 when she heard Vrel's voice coming down the hall, sharper than usual. Who ordered this? Who authorized a titration change on bed 12? She heard the resident Darren Holt, 28 years old, and still at the phase of residency where he apologized before he'd finished processing whether he'd done anything wrong, say. The night nurse flagged a CO2 trend, and the fellow agreed. That's wonderful. The fellow is also not the attending of record. This is not a nursing-driven unit. The nurses observe. I decide. Is that still a difficult concept? Nora kept her eyes on the ventilator screen. Patrick appeared in the doorway of bed 4, mouth slightly open. She was still new enough that this registered as something exceptional. Nora said quietly, "Don't react. He's watching to see who reacts." It's insane. Yes, Nora said. Titration was the right call, by the way. She finished charting and moved on to bed 6. The call from the ER came at 10:47. She wouldn't have known that detail, except that she'd just checked the time, because her third patient's family had a standing call scheduled at 11, and she was trying to estimate whether she'd make it back to the room before then. The overhead chime went first 3 tones. The mass-casualty signal, a sound she had not heard inside a hospital in a long time, and then charge nurse Doreen Yap was on the intercom, saying, "All available ICU staff, we're receiving overflow from ER. Multi-vehicle incident, Ridgeback Overpass. Initial count is 40+ casualties. All hands to staging." Nora set down the chart she was holding. 40+, the overpass. She knew that stretch of Highway Everyone in Tucson. Knew it. 3 lanes each direction, aging infrastructure, a notoriously bad merge, where 2 commuter routes met above a dry wash. She had driven it twice a week for 3 years. She went to staging. The next hour moved the way mass casualty events always did. Not in a single coherent rush, but in overlapping, ragged waves, each one arriving before the previous one had been fully processed. Ambulances, gurneys, people in clothes that had been ordinary 45 minutes ago and were now dark with blood and dust and the particular gray residue of pulverized concrete. The ER had already triaged its immediate space and was routing the less critical upstairs. Nora's unit absorbed 7 patients in the first 40 minutes, ranging from crush injuries to a teenage girl with a fractured pelvis who kept asking about her brother in a voice that was so controlled it was worse than screaming. Nora worked. She had done this before, the particular rhythm of it, the way you stopped thinking about the whole and started thinking about the immediate, the one patient in front of you, the one intervention, the next 30 seconds. She moved between beds with the economy of someone who had learned, in a context that had nothing to do with hospital hallways, that wasted motion was a kind of failure. Vrel was downstairs, she knew. Downstairs, where the real critical cases were coming in, running his protocols, issuing his directives. She didn't think about him. At 11:52, a trauma notification came through for a patient being transferred from ER to the ICU. Randall Breck, 44, construction worker, impalement injury, steel rod, submandibular, hemodynamically unstable, active airway compromise. She read the transfer note twice. Steel rod, submandibular. Below the jaw, the note said imaging had confirmed the rod's trajectory. It had entered at an angle, passing through soft tissue, and come to rest approximately 2 centimeters from the right common carotid. The patient was awake but deteriorating. His oxygen saturation was dropping. He had been intubated in the field, but the tube was poorly positioned. The impaled rod made standard airway access nearly impossible. And the paramedics had done what they could. Nora went to the supply room. She pulled a surgical airway kit, a cricothyrotomy tray, a size 7 cuff track tube, and 3 additional items that she placed on the cart by memory. The way you did when you'd pulled the same items so many times, they lived in your hands before they lived in your mind. She was already moving toward the elevator when she heard Doreen say, "Callum, I don't think that patient is being assigned to your section." "Then I'll hand him off when I get there," Nora said. She didn't stop moving. The elevator opened on the ground floor, and she stepped out into what had become, in the last 90 minutes, something that only loosely resembled the emergency department she knew. Gurneys in the hallways, IV poles repositioned to make room. The smell copper and antiseptic, and something underneath both that she recognized from a different time, was thick enough to taste. She followed the noise to Trauma Bay 3. Randall Breck was on the table. He was a big man, broad-shouldered, still in his work clothes, orange safety vest, heavy canvas pants, one boot, the other presumably lost at the scene. The steel rod entered at an angle below his right jaw and extended outward approximately 14 inches, wrapped at the exposed end in what looked like a piece of latex glove someone in the field had used to pad the exit point. His color was wrong. Not the gray of shock something more specific, the blue-tinged pallor of a man whose airway was losing the argument. Dr. Vrel was standing at the head of the bed. He was not touching the patient. He was looking at the monitors, then at the rod, then at the monitors again, and his jaw was doing a very particular thing working, that Nora recognized as the physical expression of a man who knew what needed to happen and could not make himself do it. 2 residents flanked him. A respiratory therapist stood at the equipment cart looking at Vrel for instruction. A nurse Nora didn't recognize was at the IV pole, hands busy with fluids, but eyes darting upward every 3 seconds. Dr. Vrel, the respiratory therapist, said, "Not for the first time. By the sound of it, SATs are at 81 and trending. I'm aware of the saturation." His voice was clipped. "Give me a moment." "He doesn't have a moment," Nora said. The room tilted. Every face turned. Vrel's eyes found her over the gurney. "Callum, what are you doing in this bay, looking at your patient?" She set the supply cart at the foot of the bed and moved toward the head. "He needs a surgical airway. The rod is displacing his trachea, and your existing tube isn't compensating. You've got maybe 90 seconds before the SAT drops below the recovery threshold. You are an ICU nurse assigned to the 3rd floor. You are not cleared for this bay. You are not on the surgical team, and you will step back. I will step back after someone does the airway. I am deciding the approach. You've been deciding for 4 minutes." She looked at the respiratory therapist. "What's the current SAT?" The therapist looked at Vrel. Vrel's expression had gone very still. 79, the therapist said. Nora pulled on gloves. "I need betadine, a 10-blade, a hook retractor, and someone to manage the rod. Don't move it, just stabilize it. Don't let it shift while I work. Callum." Vrel's voice had dropped to something low and deliberate. "You are not authorized. Marcus." The voice from the doorway was calm, measured, and belonged to the charge RN for the ER, a woman named Sadie Holt, who had worked at Harrow Peak for 19 years, and who Nora knew had exactly 0 tolerance for protocol over pulse. "Your patient is at 79% on a declining trend. Either you do the airway, or you tell me who's doing it, but someone is doing it in the next 60 seconds. The room waited. Vrel looked at Breck. He looked at the monitors. He looked at the rod. "I'll supervise," he said. Nobody moved for exactly 1 second. Then Nora reached for the betadine. She had done this procedure 9 times in her life. She knew that number exactly because she had counted them over the years, the way you counted certain things that you never expected to count again. The first time had been in circumstances so far removed from a clean trauma bay, and proper lighting that the memory of this gloves, betadine, a surgical kit, a table felt, almost luxurious by comparison. She prepped the site quickly, working around the rod, communicating in short sentences to the residents she'd conscripted. Hold here. Don't let that shift. Tell me if his pressure drops more than 10 points. Resident Darren Holt was on her left. He was scared. She could see it in the set of his shoulders, but his hands were steady, which was the part that mattered. Have you done a crick before? She asked him. Simulation only. Good enough. Watch the angles. If I tell you to retract, you retract toward me, not up. Got it? Got it. Vrel was at the foot of the bed. He had not left, which she hadn't been certain about, and he had not said anything else, which she had been more certain about. She did not look at him. The incision was small, clean, placed in the one window of accessible tissue the rod's trajectory had left available. She worked by feel as much as by sight. The landmarks were distorted by swelling, and the rod's presence meant she couldn't use her usual reference points. She adapted. She had adapted to worse. Sat, she said. 76, the therapist said. She worked faster. Not rushed. There was a distinction that most people didn't understand. Between speed and rushing was what happened when fear overtook the hands, when the urgencies of the situation started making decisions instead of the person. What Nora did was faster, but not rushed. It was the difference between a controlled burn and a wildfire. The tube went in. Bag him, she said. The therapist connected the bag. Squeezed. The chest rose. Nora watched the monitor. 76, 78, 81, 86, 91, 94. The trauma bay was completely silent. Randall Breck's color began, very slowly, to change. The bluish undertone receded. His chest rose and fell in the steady, mechanical rhythm of the bag ventilation, and his monitors settled into a pattern that looked, for the first time since he'd come through the door, like something recoverable. Nora stepped back from the table. Her hands were not shaking. They never shook during. Afterward sometimes, but not during. She stripped the outer gloves and turned to the respiratory therapist. Get him connected to the vent, SIMV mode. FiO2 at 100 to start, wean based on SAT. He needs vascular surgery to consult on the rod before anyone touches it again. Do not, she looked around the room, do not attempt to remove that object. Anyone. Under any circumstances. Until vascular is in this room, and imaging has confirmed the current trajectory is stable. Heads nodded. The therapist was already moving. She became aware, incrementally, of the way the room was looking at her. Not the way they'd looked when she walked in. Something had shifted, the angle of it, the quality. The residents were watching her with expressions she'd seen before, but not often, not directed at her, not here. Darren Holt was looking at her hands. She moved to the chart cart and began documenting. Dr. Vrel hadn't moved from the foot of the bed. Callum, I'm documenting the procedure. We need to discuss what just happened. Yes, she continued writing. We do. But this patient needs continuous monitoring. Vascular needs to be paged if they haven't been already. And there are 11 other critical patients in this department who are not currently being watched because everyone available is in this room. So documentation first, discussion second. She heard him take a breath. Then she heard him say to Darren Holt, page vascular. And get me an updated census from triage. She kept writing. By 1:30 in the afternoon, the mass-casualty surge had stabilized into what emergency departments called the second phase. Not the initial chaos, but the grinding, exhausting work of managing what the chaos had left behind. Patients were assigned, surgeries were scheduled, families were in waiting rooms or on phones, or, in 3 cases, in consultation rooms with social workers and the particular devastating quiet of rooms where bad news has just been delivered. Nora had returned to the ICU, resumed her original patient load, and was in the middle of a ventilator assessment on bed 6 when Doreen Yap appeared in the doorway. Vrel wants you downstairs, Doreen said. Tell him I'm in the middle of an assessment. He said, when you're done. Then tell him I'll be there when I'm done. Doreen hesitated in the doorway, with the look of someone who had been a buffer between difficult people for long enough that she'd developed a specific kind of tired. Nora. He's not happy. He wasn't happy before I did the airway. He's not happy after. The difference is, now there's a man alive who wouldn't be. She adjusted the ventilator setting and made a note. I'll be down in 15 minutes. Doreen left. Petra, resetting an IV at the next bed, said, Are you in trouble? I'm always in some degree of trouble, Norsa said. That's what happens when you keep being right. She wasn't being flip. It was just the truth as she'd experienced it. At Harrow Peak, being right in a way that made an attending look wrong was a special category of problem, separate from and more dangerous than simply being wrong yourself. If you were wrong, you got corrected, and the hierarchy stayed intact, and everyone moved on. If you were right loudly, visibly right, in a room full of witnesses, during a mass casualty event, with a patient whose saturation you'd saved from the 70s to the 90s, then you had done something that the hierarchy had no clean mechanism for processing. She had known that when she picked up the gloves. She had made the calculation, the way she'd made similar calculations before, in different contexts, and she'd made the same choice she always made when the calculation involved someone dying on one side of the scale and institutional consequences on the other. She went down at 1:52. Vrel was in the small conference room adjacent to the ER director's office. He was standing when she arrived, which meant he'd planned to be standing, which told her something about the conversation he'd prepared. Close the door, he said. She closed it. She didn't sit down, because he hadn't sat down. What you did in that trauma bay was a serious breach of protocol, he said. He had his arms crossed, the posture of a man who had rehearsed this framing. You entered a bay you weren't assigned to. You performed an invasive procedure without authorization from the attending of record, and you circumvented the chain of command during an active mass casualty event. I did, Nora said. He blinked. He'd expected pushback, or an apology, or at minimum some kind of defensive posture, and her simple agreement destabilized the speech he'd built around a different response. You understand that this is a terminable offense. I understand that you have the option of framing it that way. Yes. It's not a matter of framing, Callum. The hospital has policies. The hospital has policies that exist to protect patients from harm. She kept her voice level. Randall Breck is alive. His saturation was at 76% when I intubated him. It was at 94 when I stepped back. You can look at the documentation, which I completed and submitted. You can also look at the 4 minutes of monitoring records before the intervention, during which the saturation was declining continuously and no intervention was initiated. The silence in the room had a different texture than the silence in the trauma bay. That one had been stunned. This one was careful. I was assessing the situation, Vrel said. I know. Surgical airways carry significant risk. They do. Less risk than a SAT of 76% with a declining trend in a patient with compromised airway anatomy. She paused. I'm not trying to make this adversarial, Dr. Vrel. I'm telling you what happened, because I think we both already know what happened, and I think whatever happens next should be based on the actual facts rather than the version of events that's more convenient for either of us. Something moved in his face. Not capitulation. Not that. Something more complicated. A man reassessing terrain he thought he knew. This conversation isn't finished, he said. I didn't think it was, she said. Let me know when you want to continue it. She walked out. In the hallway, she leaned against the wall for exactly 4 seconds, long enough to let the adrenaline that she'd been suppressing since the trauma bay work its way through her system in one controlled wave. Her hands were shaking slightly now. She looked at them, pressed them flat against her thighs, waited until they stopped. Then she went back upstairs. The afternoon passed in the way afternoons did after crisis, slower, the pace more recognizable, but with an undercurrent of not quite settled that everyone in the department was navigating around with naming. She overheard two residents talking in low voices in the break room. She caught Sadie Holt watching her from across the nurse's station with an expression that was part assessment, part something Nora didn't have a clean word for. Nobody said anything directly. At 4:15, while she was reviewing labs on bed 9's arterial blood gas, her phone buzzed. Unknown number. Tucson area code. She almost didn't answer. She was in the middle of a calculation. She answered. The voice on the other end was male, measured, with the particular flatness of someone accustomed to delivering information in compressed, efficient packets. Is this Nora Callum? It is. Harrow Peak Medical Center, ICU. She went still. Who is this? My name is Commander Dale Bryn. I'm trying to reach Nora Callum, who previously served as a Navy combat medic attached to a Special Operations medical unit out of Minas. You have the wrong person, she said. A pause. I said you have the wrong person. Her voice was calm, professionally calm, the kind of calm she'd spent 3 years building into reflex into this hospital. I have to go. I'm with patients. She ended the call. She stood at the nurse's station for a moment, with the phone in her hand. Petra walked past with a bag of fluids and said, without looking up, "You okay?" "Fine," Nora said. She put the phone in her pocket and went back to the blood gas. But she stood there for longer than she needed to. The numbers didn't change. She wasn't really reading them. The call had not been from a number she recognized, but the name of the unit that Commander Dale Bryn had begun to say. She had not let him finish, but she had recognized the first 4 words. 4 words was enough. She knew exactly who was trying to find her. She knew exactly why, and she knew, with the particular certainty of someone who has spent years constructing a very specific kind of distance between who they are now and who they used to be, that whatever had started that phone call was not something she could keep at the length of a hang-up. Downstairs, in a trauma bay he didn't know existed. 6 hours ago, Randall Breck was breathing on a ventilator that Nora had secured. Upstairs, in a conference room she'd just walked out of, Marcus Vrell was deciding how to reclassify what she'd done into something his authority could contain. And somewhere in Tucson, a man named Commander Dale Bryn was almost certainly making a second call. Nora pulled up the blood gas results, entered the values, and began calculating the adjustment. Her hands were steady. But for the first time in 3 years, the distance she'd built was starting to feel like exactly the wrong kind of barrier. Not a wall that protected her, but a wall that was about to be walked through by someone who already knew where the door was. The adjustment she calculated was a 2-point increase in the respiratory rate and a fractional drop in tidal volume small corrections, the kind that didn't look dramatic on paper, but mattered considerably to the man in bed 9, whose CO2 levels had been drifting in a direction that nobody else had caught yet because nobody else had the full gas panel against his admission weight. She entered the order, flagged it for the covering resident, and went to check on her other patients. Commander Dale Bryn did not call back that afternoon. She kept waiting for the buzz in her pocket. It didn't come. By 5 o'clock, she'd half convinced herself that the silence meant something, that he'd confirmed he wasn't the right person, or that whatever had prompted the call had resolved itself through other channels. By 6, she'd stopped thinking about it entirely, or told herself she had. It wasn't quite the same thing, but functioned well enough. The evening shift brought a new wave of problems. 2 of the mass-casualty overflow. Patients developed complications. 1 a surgical site issue. 1 a sudden fever that needed a full sepsis workup set. And the ICU that had been stretched thin all day was now operating at the kind of margin where everyone moved faster and talked less. Nora's own patient in bed 6, the 63-year-old with the climbing oxygen requirements, had worsened. She'd escalated twice. The covering fellow, a young woman named Priya Sandhu, who was sharp and willing to listen, had come personally to review the settings and agreed with Nora's assessment. "I want to bump the PEEP," Sandhu said, looking at the waveforms. "I'd go 5 to 7. His compliance is worse than this morning. And his plateau pressures are trending up." "Yeah, let's do it." Sandhu typed the order. "Has Vrel been in to see him?" "Not since rounds this morning." Sandhu made a sound that was not quite a comment. She didn't need to. They both knew what it meant. The change helped. By 7:30, the patient's numbers had stabilized, not dramatically, but enough. The kind of enough that felt provisional, but was better than the alternative. Nora documented everything, the way she always did, with the specificities of someone who had learned that documentation was the only history that survived disagreement. She was leaving the room when Doreen materialized at the end of the hall with a look on her face that Nora had cataloged over 3 years into a specific category: bad news being carefully carried. HR called, Doreen said. Vrel filed a formal incident report. Nora stopped walking. When? Late afternoon. It was routed to the nurse manager and the ER director. Doreen was keeping her voice low, the particular low of someone aware of the acoustics of a hospital corridor. "I don't know the full language, but the summary is unauthorized practice, beyond nursing scope, insubordination during a mass casualty event, and a separate notation about your conversation this afternoon in the conference room." He characterized the conversation. He characterized it as confrontational. Nora absorbed this. "Okay, Nora, this is serious. They can suspend you pending review. I know what they can do," she said it gently. Not dismissively. She genuinely didn't want Doreen to think she was minimizing it, because she wasn't. She was prioritizing. "Is my documentation in the system?" "Yes," I'd checked. "Is Breck's current status documented under my intervention?" "The procedure note is in. The respiratory therapist co-signed it. Darren Holt's name is on the assist." "Good." She started walking again. "Then let them review it." "That's your response?" "That's my response." Doreen walked with her for a few steps, then stopped. "You're not scared." It wasn't exactly a question. Nora thought about how to answer it honestly, which took a moment, because the honest answer was more complicated than yes or no. "I've been in situations where being scared used the time I needed to think," she said finally. "I stopped letting it do that a long time ago." She glanced back at Doreen. "Go home. You're 40 minutes past your shift." Doreen went home. Nora went back to work. The incident report landed on nurse manager Carol Siv's desk at 7:50 that evening, and by 8:15 it had been routed to ER director Dr. Philip Oakes, who read it once, called Vrel's extension, got voicemail, and spent the next 20 minutes reading the procedure note and the contemporaneous documentation from 3 separate staff members before calling Vrel again. Nora didn't know any of this at the time. What she knew was that at 8:47, while she was doing a final med reconciliation on bed 3, Carol Stave appeared in the ICU and asked her to step into the manager's office. Carol Stave was a woman in her early 50s, who had the careful, measured demeanor of someone who had seen enough hospital politics to understand that the truth and the official account were not always the same document. She sat across from Nora with a printed copy of Vrel's incident report on the desk between them, and she did not, to her credit, begin with anything that sounded like a verdict. "Walk me through what happened in Trauma Bay 3, she said. Nora walked her through it. She was specific. She used times, saturation values, the precise language of the procedure, the sequence of events from her arrival through documentation. She did not editorialize. She did not characterize Vrel's hesitation in any terms except the observable ones, the time elapsed, the saturation trend, the absence of an initiated intervention. Carol listened. She asked 3 questions. She wrote notes. When Nora finished, Carol looked at the incident report for a moment without speaking, then looked up and said, "Doctor, Vrel has indicated that you performed this procedure without his authorization. I performed it in his presence. He was at the foot of the bed. He says he was preparing to act. The patient's saturation was 76% and declining. I have the monitor data in my documentation. She paused. I understand that my actions can be characterized as outside standard nursing scope. I also understand that there is a difference between a policy and patient outcome, and that this particular hospital has a history of prioritizing the former in ways that have occasionally affected the latter. She held Carol's gaze. I'm not saying that to be combative. I'm saying it because I think you already know it's true, and I think this situation deserves honesty more than it deserves careful language. Carol looked at her for a long moment. Something shifted in her expression. Not agreement, exactly. Recognition, maybe. I'm going to need you to write a full narrative account, Carol said. Everything you've told me, in writing, submitted by end of shift. I'll have it to you in 45 minutes. Carol nodded. She stood. She started to leave, then stopped at the door. Off the record. Okay. Was there another option for the patient? Nora thought about it for a real second. Not as a rhetorical maneuver, actually thought about it, the way she ran through clinical decisions, testing the branches. If his SAT had held above 85 and Vrel had initiated within the next 60 seconds, there was a window where the existing tube might have been repositioned successfully, she said. Maybe. The swelling pattern made it uncertain. Below 80, with the trajectory of decline we were seeing, she stopped. No, there wasn't another option. Carol left. Nora wrote the narrative. It took 40 minutes. She submitted it at 9:31 and then sat at the nurse's station for a moment, in the particular quiet of a hospital at night. When the daytime noise had drained off and what was left was the ambient sound of machinery and the distant shuffle of overnight staff. She took out her phone. No missed calls from the unknown number. She put the phone away and started her end-of-shift handoff. She was in the parking garage at 10:15, keys in hand, when she heard footsteps behind her. Not running, measured, deliberate. The gait of someone who knew where they were going and had calibrated their approach. She turned before the person spoke. He was tall, somewhere in his late 40s, in civilian clothes, dark jacket, plain shirt, the particular anonymous quality of someone who had spent a long time learning not to be notable. His haircut was short and functional. His posture was the kind that didn't come from a gym. Nora Callum, he said. Not a question. Your Bryn, she said. He stopped about 8 feet away. I didn't think you'd hang up on a second call. I didn't give you a chance to make one. No, you didn't. He had the faint trace of something she couldn't immediately place. Not quite regional, not quite military cadence, something that had been smoothed down by years of adapting to whatever room he was in. I've been in the parking structure for about 2 hours. That's a long wait. I've waited longer. He paused. You remember why? She did. She wasn't going to confirm it in a parking garage at 10 at night to a man she hadn't seen in 5 years and had no verified reason to trust the civilian version of. What do you want? To talk. About what? About something that needs a person with your particular set of qualifications, he said. And before you tell me again that I have the wrong person, he reached into his jacket and produced a folded document, held it out at a distance she'd have to close to take. Your service record is not as buried as you think it is. She didn't move toward the document. What happened? The unit you worked with. One of the medics who came up after you. Corpsman First Class named Elliot Reyes. He's in your hospital right now. He came in through the mass-casualty intake, this afternoon civilian vehicle, Ridgeback Overpass. The name registered. Reyes. She hadn't known his first name back then. She'd known his face, his hands, the specific way he taped field dressings that she'd taught him herself during a 12-hour rotation in conditions that made Trauma Bay 3 look like a spa. He's here, she said. ICU. 3rd floor. Bryn watched her. He doesn't know you're working here. I'm not sure he's conscious enough to know much of anything right now. He paused. But I knew. And I came to tell you in person because I figured you deserved that more than a phone call. She stood in the parking garage with her keys in her hand and worked through the information the way she worked through a clinical presentation systematically, without letting the emotional content of it run ahead of what she actually knew. Elliot Reyes, third floor ICU, which meant he'd come through the intake she'd been working all afternoon, which meant he might have been one of the patients she'd passed a dozen times without. She stopped, ran the afternoon's admissions back through her memory. Bed 11, 32-year-old male, blunt thoracic trauma, rib fractures with hemothorax, hemodynamically stable on admission. She hadn't been assigned to bed 11. She'd passed it twice. Is he going to make it? She asked. The doctors seemed to think so. He's stable. Bryn lowered the document. This wasn't a recruitment call, Nora. I'm not here to ask you to re-enlist or consult or anything official. I came because one of your people is in your hospital, and I thought you should know. He held her gaze. And I came because word traveled about what you did this afternoon. In the trauma bay, she said nothing. A combat surgical airway on a steel impalement with a displaced trachea in a civilian ER without backup. In 4 minutes, he paused. That's not an ICU nurse doing something above her grade level. It's someone who did it before. I need to go, she said. I know. He took a step back, giving her the space deliberately, the gesture of a man who understood the value of not pressing. The document is yours if you want it. Your record. Not classified, it was declassified 2 years ago as part of a broader program review. He set it on the hood of the nearest car. You don't have to take it, but it exists. And after today, other people in that hospital are going to start asking questions that have answers in it. She looked at the document on the hood of the car. She picked it up. Thank you for coming in person, she said, and walked to her car. She didn't open the document that night. She drove home, made coffee she didn't drink, sat at her kitchen table with the folded pages in front of her for 40 minutes, and then put them in a drawer and went to bed. She lay in the dark and thought about Elliot Reyes in bed 11, breathing through a chest that had absorbed what concrete and steel could do to a body at highway speed. And she thought about the airway she'd done that afternoon. And she thought about Vrel's face at the foot of the gurney. And she thought about the incident report sitting in Carol Stave's inbox. She did not think about the document in the drawer. She slept for 4 hours. She was back at Harrow Peak by 6:15 the next morning, an hour before her shift started, because there was a patient she wanted to check on before rounds complicated access. Bed 11 was at the far end of the third floor ICU, behind a curtain that had been left 3/4 closed. She stopped outside it. The chart on the door listed the patient as E. Reyes, DOB consistent with early 30s, next of kin listed as a sister in San Diego. She pushed the curtain aside. He looked smaller than she remembered, which was the thing about seeing people horizontal and monitored. It reduced everyone to the same essential fragility. He had a chest tube on the left side, a nasal cannula, an arterial line, and the particular stillness of someone in a heavy sedated sleep. His face was bruised left, orbital, right cheek, and there was a laceration along his jawline that had been closed with suture rather than staples, which told her someone had taken care with it. She stood at the foot of the bed for a long moment. Then she checked his chart. His vitals overnight were acceptable. The hemothorax was draining well. His oxygen requirements had improved. There was a surgical consult pending for the rib fractures, but the note from the overnight attending indicated they were leaning toward conservative management pending repeat imaging. He was going to make it. Probably. Most likely. In medicine, that was the best you got. She replaced the chart and was turning to leave when someone said, "Can I help you?" The nurse coming on for the morning, a man she recognized but didn't know well, named Torres, was at the doorway with a medication tray. His expression was the politely territorial, one of someone who'd found a colleague at a patient they weren't assigned to. "I know this patient," Nora said. "Old connection." "I was checking in." Torres looked at the chart, then at her. "You're not on his care team." "I know. I'm leaving." She moved past him out of the room. In the hallway, she paused. Down the corridor, just rounding the corner from the elevator bank, was Marcus Vrell. He was in his white coat, half glasses on, reviewing something on his tablet. But he looked up when he reached the nurse's station, and his eyes found her with the precision of a man who had been expecting to see her and had prepared something for the moment. "Callum," he said, "my office. 8 o'clock. My shift starts at 7:15. 8 o'clock, he said again. He didn't raise his voice. He didn't need to. The tablet went under his arm, and he walked past her toward the physician lounge without looking back. She watched him go. At the nurse's station, Torres was entering something into the medication system. Petra was doing a shift handoff at the far end. The ICU was waking up in its morning way, the beeping and adjusting and charting, and it looked, from where Nora was standing, entirely ordinary. The way it always looked. She went to put her things in her locker. She was pulling her badge lanyard over her head when her phone buzzed. Not a call, a text, from an internal hospital number she recognized as Carol Stave's office line. Formal review board convened for 10 a.m. Your presence required. HR and ER director will be present. Dr. Vrell will present the incident report. You will have opportunity to respond. She read it twice. Then she typed back, received, I'll be there. She clipped her badge to her scrub pocket and walked out of the locker room. The morning shift was starting. There were patients to assess, medications to pull, a ventilator patient in bed 6 who needed a blood gas at 6:30 and wouldn't care that her nurse had a review board at 10. The hospital's ordinary machinery was running, and she was part of it, and that part didn't pause for whatever Vrell had filed or whatever the board had convened to decide. She went to bed 6. The blood gas was drawn. The values were sent. She was calculating the response when Darren Holt, the resident who'd assisted her in the trauma bay, who'd held the retractor and kept his hand steady, appeared at the doorway of the room with an expression that was not quite the expression of someone doing morning rounds. I heard about the review board, he said. She looked up. News travels. I wanted he stopped. Started again. I talked to 2 other people who were in that bay yesterday. Sadie Holt. The respiratory therapist, Greer. I think we're going to submit statements. She looked at him for a moment. He was young. He was still at the part of residency where he was figuring out which things were worth the professional cost of saying them out loud. You don't have to do that, she said. I know. He held her gaze. The SAT was 76. I watched it. I was standing right there. She went back to the blood gas calculation. Submit what you saw. Don't editorialize. Just what you saw. He nodded. He left. She finished the calculation, ordered the vent adjustment, and moved on to bed 7. The morning passed in a way that felt deceptively like every other morning, the rhythm of it, the accumulated small tasks that made up an ICU shift, the particular attentiveness that the work demanded. But underneath it, running like a current under a surface that looked still, was the awareness that at 10 o'clock she would be sitting in a room with Marcus Vrell and 2 administrators and a formally filed incident report, and that whatever happened in that room would determine whether she still worked at Harrow Peak after today. She had been in worse rooms. She reminded herself of this without nostalgia, just as a fact, a point of reference. She had been in worse rooms, with worse options, with far fewer allies and far higher stakes, and she had come out of those rooms because she had done what was required and nothing more. She checked on bed 9. The CO2 had normalized overnight on the adjusted settings she'd ordered. The patient, a 50-year-old man named Gary Partlow, who'd come in through the mass-casualty intake with crush injuries to his lower extremities, was awake this morning, groggy and disoriented, but tracking well enough to respond when she asked him to squeeze her fingers. Am I going to be okay? He said. His voice was thick, the way voices were with long-duration sedation. Your numbers look better this morning, she said. Not a lie, not the whole truth, because nobody at this stage got the whole truth. They got the manageable piece of it. Your team will come by during rounds and go through everything with you." He closed his eyes, then opened them again. "The nurse last night, was that you?" She didn't know which thing he was referring to. She hadn't been his overnight nurse. "I'm your day nurse. My name's Nora." "Nora," he repeated, like he was filing it. "Okay." She finished the assessment, charted, and moved on. At 9:45, she washed her hands at the station sink, checked that her assignment was covered for the next hour, and walked to the elevator. The review board was in the third-floor conference room, a room she'd been in for safety meetings and case reviews, and exactly once before for a discussion about a patient complaint that had turned out to be a miscommunication. It was a long rectangular room with a whiteboard on one end and a window that looked out at the parking structure. There was a table with 8 chairs. When she arrived, 5 of the chairs were occupied. Carol Stave on the left. Philip Oakes, the ER director, in the center a heavy-set man in his early 60s, with the deliberately neutral expression of someone who had chaired enough of these to have learned that showing what he thought before he'd heard everything was counterproductive. An HR representative named Whitfield on the far right with a laptop open. And Marcus Vrell, 3 seats down from Oakes, with a folder in front of him and his hands flat on the table. He didn't look up when she came in. There was one empty chair across from Oakes. She sat in it. "Thank you for being here, Miss Callum," Oakes said. "You understand the nature of this review." "I do." Dr. Vrell's incident report raises concerns about scope of practice and chain of command. We're going to review the documentation from both parties and from supporting witnesses before we make any determinations. You'll have an opportunity to speak to your account. He folded his hands. "Dr. Vrell, you filed the report. Do you want to begin?" Vrell opened his folder. He was good at this. Nora had known he would be men. Like Vrell were always good at this part, the formal presentation, the careful language that turned events into a particular shape. He spoke for 8 minutes. He described the trauma bay situation in terms that were technically accurate and contextually misleading. Nora's unauthorized entry, her performance, an invasive procedure without attending authorization, her confrontational posture in the conference room's section, the precedent danger of nursing staff performing surgical interventions based on their own clinical judgment. The patient survived, he acknowledged, but the relevant question isn't the outcome. The precedent set by allowing nursing staff to override attending-level decisions, especially during a mass casualty event when protocol adherence is most critical, is a patient safety concern that extends beyond this individual case. He closed the folder. Oakes looked at Nora, Miss Callum. She laid her written narrative on the table. She had printed 3 copies. She slid one to Oakes, one to Carol, one to the HR rep. "The saturation values and timestamps are in the documentation," she said. "At the time I initiated the procedure, the patient had been declining for 4 minutes with no intervention initiated. The attending was present and had verbally acknowledged the situation. The saturation was at 76%. She kept her voice even. I'm not going to argue about protocol. The protocol exists. I understand it. I also understand that the protocol is a framework, not a substitute for clinical judgment in time-critical situations, and that the patient in question would not have survived another 60 to 90 seconds without airway access. That's objective assessment, Vrell said. It's documented by 3 independent witnesses who were in the room. The respiratory therapist's note, the resident's note, and the charge RN's observation all placed the saturation below 80 at the time of my intervention. She looked at Oakes. I'm not here to defend myself from the incident report. I'm here to provide context. Whatever this board decides about my employment or my scope of practice, the patient is alive, and the documentation reflects what happened accurately and completely. The room was quiet. Oakes looked at the pages in front of him. He hadn't taken his reading glasses out, which meant he'd already read them probably last night, probably more than once. We have 3 written statements from staff who were present in the trauma bay Carol said, which was the first Nora had heard that more than Darren Holt had submitted. 2 from clinicians and 1 from nursing. All 3 corroborate the saturation values and timeline described in Ms. Callum's account. Vrel was very still. Additionally, Carol continued, with the careful tone of someone delivering information she had verified and re-verified. A review of the patient monitoring records from Trauma Bay 3, pulled from the central system this morning, confirms that the saturation reached a nadir of 74% approximately 90 seconds before the procedure was completed and began recovery. 74. Lower than Nora had thought. She kept her expression neutral. Vrel said, "I was assessing Marcus." Oak said it quietly, with a weight in the single word that ended the sentence before it started. He looked at Vrel over the top of his glasses for a moment. Then he looked at his hands. Then he looked at Nora. "This review is going to require additional time," he said. "We're not making a determination today. I want to be clear about that. But I want to also be clear," he glanced briefly at Vrel, then back, "that the documentation currently before us raises questions that extend beyond Ms. Callum's actions in that trauma bay." Nora said nothing. Vrel said nothing. The HR representative typed something. "We'll reconvene Thursday," Oak said. "Both parties will be notified of any interim decisions. Ms. Callum, you're on regular assignment in the meantime. Dr. Vrel, your ER assignments for this week will be reviewed by my office." She hadn't expected that last part. From the slight shift in Vrel's posture, neither had he. She stood, thanked Oakes by name, and walked out. In the hallway, she stood for a moment, breathing through her nose in that controlled way she'd developed for the spaces between things, between the decision and the consequence, between the action and the accounting. The review board had not exonerated her. It had not disciplined her. It had done something more complicated. It had put the documentation on the table and acknowledged that both sides of this needed scrutiny, which meant Thursday, which meant she had 3 days. She was walking back toward the ICU when her pager, the old hospital pager she carried on shift because the overhead system still had coverage gaps on the 3rd floor, buzzed with a code alert. Not for the ICU, for the 1st floor, the lobby. She heard the overhead a second later, code gray, main entrance. Security to the main entrance, code gray. Combative individual or situation requiring security. She started moving anyway because the main entrance was between her and the elevator, and because code gray calls that came from the lobby sometimes escalated and the ICU needed to know what was below them. She came down the stairs and pushed through the stairwell door into the ground floor corridor, and stopped. The main entrance lobby was not a combative individual. 3 men in civilian clothes, moving with the purposeful, coordinated gait of people who had not come to wait in line at admissions. 2 of them were at the reception desk, speaking rapidly to the security officer. The 3rd was standing slightly apart, scanning the lobby with the unhurried thoroughness of someone running a perimeter check. Turned, and his eyes landed on her. Commander Dale Bryn. He didn't look surprised to see her. He looked, if anything, relieved, in the way people looked relieved when the thing they'd been bracing for finally began. He crossed the lobby toward her. "I need 5 minutes," he said. "I'm on shift, I know. 5 minutes." He stopped close enough to speak quietly. "Reyes woke up an hour ago. He's coherent. He's been asking for you by name." He paused. "Not because he recognized you from his intake, because he knows you work here. He's known for 3 weeks. He reached out to me 2 days before the overpass collapse." She stared at him. "He came to Tucson, specifically, because you were here," Bryn said. "And before you ask, no, I don't know the full reason. He wouldn't tell me until he could tell you himself." He looked at her steadily. "But Nora, whatever he's carrying, he came a long way to give it to you. And right now he's awake, he's stable, and the window where he can have this conversation may not be as long as we'd like." She looked past Bryn toward the elevator bank. 3rd floor. Bed 11. 5 minutes, she said. She walked to the elevator. The doors opened. She stepped in. Bryn moved to follow her, and she put one hand flat on the frame. Not aggressive, just definitive, and said, "I'll go alone." He stopped. She let the doors close. The elevator hummed upward. She watched the floor numbers change ground, 2, 3, and she thought about Elliot Reyes lying in bed 11, 2 days before the overpass collapse, making a phone call to a commander he trusted, saying the name of a hospital and a nurse who had spent 3 years very carefully, being no one. The doors opened on the 3rd floor. She stepped out, turned right, past the nurse's station, past bed 9 where Gary Partlow was sleeping, past the gap between bed 10 and the supply alcove, and reached the curtain of bed 11. She pushed it aside. Elliot Reyes was awake. His eyes brown, sharp, despite the bruising around the left one, still carrying the particular alertness of someone who had been trained to stay aware of their surroundings, even when their surroundings were an ICU found her immediately. "Hey, Callum," he said. His voice was rough, thick, with the residue of sedation and a bruised chest, but the recognition in it was immediate and complete. "Hey, Reyes," she said. She let the curtain fall closed behind her. He opened his mouth to say something, and then stopped. His expression changed. Not pain, though there was clearly that, something underneath it, something more complicated that she hadn't seen on his face in the 5 years since she'd known him. Something that looked like the expression a person made when they'd been carrying something for a long time and had finally arrived at the place they'd meant to put it down. "There's something you need to know," he said. She pulled the chair beside the bed and sat. "I'm listening," she said. And Elliot Reyes, who had driven from 3 states away on a specific mission, who had been in a vehicle on the Ridgeback overpass 2 days before he'd meant to find her, who was now breathing through a chest tube and a bruised rib set in a hospital he'd come to Tucson to reach, looked at the ceiling for one moment, and then looked at her and began to tell her something that, by the time he finished, was going to change every calculation she'd made about how long she could keep her past at a manageable distance. What Elliot Reyes told her took 11 minutes. She knew the duration because she was the kind of person who noted time automatically, the way other people noted temperature or sound, a habit, built so deep it had stopped feeling like a habit and started feeling like breathing. 11 minutes, while the monitors beeped their steady arithmetic around them, and someone in the hallway pushed a medication cart with a wheel that needed grease, and Reyes talked in the careful, measured way of a man who had rehearsed this, but was still finding it harder than he'd expected. The short version, the version that fit into something she could process in real time. Was this 6 weeks before the Ridgeback overpass collapse? Elliot Reyes had been working a civilian security contract in Denver. One of his team members, a former Army logistics specialist named Decker, had gotten into a conversation with a hospital administrator at a fundraising event, not Haro Pica facility in Phoenix, much larger, connected to a regional network. The administrator had been drinking and had said several things he shouldn't have said about staffing decisions, about how certain high-liability nurses were handled when they became inconvenient. He'd used the phrase, managed out cleanly. Decker hadn't thought much of it at the time. But then Decker had mentioned it to Reyes, because one of the specific names the administrator had mentioned, in the context of describing how cleanly a particular case had been handled 3 years ago, was Nora Callum. Reyes had heard that name before. He'd written it down. He'd made some calls. What he'd found over the next 4 weeks was a documentation trail, not comprehensive, not clean, but traceable, suggesting that the incident that had ended Nora's military medical career had not ended the way the official record described it. There had been a complaint, a formal one, filed by a senior officer against Nora's commanding medical officer for falsifying a field assessment report, a report that had placed blame on a junior medic for an outcome that the senior officer believed had been mishandled at a command level, not a care level. That complaint had been filed, and then it had been administratively buried, not quite redacted, just routed to a dead-end office where paperwork went when it was inconvenient, but couldn't be destroyed outright. And the administrator in Phoenix, drunk at a fundraiser 6 weeks ago, had mentioned Nora Callum's name in the context of knowing that she had left military medicine under a record that wasn't accurate. Had mentioned it casually, the way people mentioned leverage they didn't think they'd ever have to use, but liked knowing existed. Which meant someone in the civilian medical network knew what was in that record and had been sitting on it. "How long have you known all of this?" she asked. Her voice was steady. She'd gotten good at that, the steadiness, but it cost something every time. "About 3 weeks. That's when I found enough to be sure." Stout. Reyes shifted slightly and she watched the pain move across his face brief, controlled the expression of someone who'd been trained not to show it, but hadn't fully beaten the instinct. "I tried to call you. Landline, your old contact. It was disconnected. I changed everything when I moved here." "I know. That's why I called Bryn." He had a current number. He paused. "I was going to come 2 days after the overpass." She looked at the chest tube. Obviously, that changed. Obviously. Something almost wry in his voice, the dark humor of someone who'd spent enough time around catastrophe that it had become a tone rather than a reaction. "Nora. The administrator's name is Howard Greel. He's on the board of a regional health system that includes 3 hospitals in Arizona. One of them is Harrow Peak," she said. He looked at her. "I know," she said. "I didn't know about Greel. But I know how the system here operates. I've been watching it for 3 years." She sat back. "He knows about my record. He knows the version of your record that was filed. The falsified one. Which means if he ever needed to," she stopped, "discredit you, make something you did look like a pattern, instead of a decision." "Yes." Reyes met her eyes. That's what the drunk administrator was describing at the fundraiser. Not a past event. A contingency plan, something in a drawer in case. She thought about the incident report, about Vrel's folder flat on the table, about the review board on Thursday. "He's not in a drawer anymore," she said. "What happened?" she told him. Not everything. She gave him the shape of it, the airway, the incident report, the review board, the timeline. He listened professionally. He listened the way he'd always listened, with the specific attentiveness of someone who was building a picture rather than just collecting information. When she finished, he said, "That's not coincidence." "No. Vrel files an incident report after a mass casualty event where you performed a life-saving intervention he failed to initiate, and it goes immediately to the board level." He shook his head slightly, then stopped because the movement pulled at his ribs. Someone moved that fast. Incident reports at a facility this size normally take 72 hours to route. She had not thought about the routing speed. She thought about it now. "I need to go," she said. She stood. "I'll come back." "Nora." He caught her gaze. He looked tired, the kind of tired that lived in a person's eyes rather than their posture. "Be careful about what you think you know and what you can prove. Those are different problems, I'm aware. And be careful about Bryn." She paused. "Why?" "He's not wrong," Reyes said carefully. "But he's got his own agenda for why he found me and why he drove to Tucson, and it's not purely altruistic. It never is with him." He held her eyes for a moment. "He wants something from this. I just don't know yet what it is." She absorbed that, filed it. "Get some sleep. Don't try to sit up before they clear you. You sound like a nurse." "I am a nurse." She pushed through the curtain. In the hallway, Dale Bryn was waiting. Not in the lobby where she'd left him. He'd made his way upstairs, which told her something similar with hospital navigation and the limits of Code Gray, as a deterrent for someone who moved the way he did. "Well," he said, "not here." She walked toward the break room. He followed. The break room was empty. She checked both ways before she let the door close, and then she turned and said, "Howard Greel." Bryn's expression didn't change, which was its own kind of answer. "You already know that name," she said. "I know the name." "Then you know what Reyes told me. I know a version of it." He sat down at the break room table. Not the posture of someone casual, the posture of someone who decided that sitting signaled honesty. Greel has been on the regional board for 11 years. He's not the only person with access to misfiled military medical records, but he's the most prominent civilian I've found who's pulled that particular thread. Why are you pulling it? He looked at her. Because it's wrong. That's not an operational answer. No. He paused. The unit you served with. After you left, there were 3 more incidents of field assessment reports being altered. 3 more medics who took institutional blame for command failures. 2 of them are out of medicine entirely. One of them is, she's not doing well. He said the last part without elaborating, and she didn't ask, because the way he said it told her enough. I've been building the case for 2 years. Reyes is part of it. Your record is part of it. The falsified report that ended your service is one of 7 I've documented. She sat down, not because she needed to, because the weight of 7 reports, 7 altered documents, 7 people's professional lives rerouted by paperwork that had been shaped to protect someone else required some kind of physical acknowledgement. What do you need from me? She said. Your original field assessment. From the incident that generated the complaint. He leaned forward slightly. The official record shows a report filed by your commanding medical officer that attributes the outcome to medic error. Your medic error. But the complaint filed by the senior officer, the one that got buried references, an original assessment document that was never entered into the record. If that document still exists. It exists, she said. He went very still. I kept a copy, she said. I kept copies of everything, from the day it happened. Because I knew what was being done, and I didn't know then how to fight it. She looked at him. I've known for 5 years. He exhaled, just once, quietly, the exhales of someone who has been holding something carefully for a long time, and has just been told he can set it down. Where? Not here, not in Tucson. She stood. I need to think about what this means for the review board Thursday. And I need to talk to someone before I make any decisions about your investigation. Talk to who? A lawyer. She went to the door. Don't come back to the hospital. I'll reach out to you, Nora. She left. The rest of her shift was the longest 4 hours. She'd worked at Harrow Peak, and she'd worked some long ones. She moved through her patients, assessments, medications, the endless documentation that was the visible record of care, and she kept her face at the particular angle it needed to be when she didn't want anyone to know what was happening inside it. She'd gotten good at that too. Years of practice, different environments, same skill set. At 3:15, while she was charting at the nurse's station, she got an email from HR. Not from Whitfield, from a higher address, the VP of Human Resources, a name she'd seen on hospital-wide communications, but never in her personal inbox. The email was brief. It noted that in light of additional information provided to the review board, the Thursday convening had been moved to Wednesday morning, 1 day earlier, at 9 a.m. It noted that Dr. Vrel would also be required to attend. 1 day earlier, she read the email 3 times. The language was neutral additional information provided, without specifying what that information was or who had provided it. But the acceleration of the timeline meant something had landed, something Oakes had seen, or Stave had surfaced, or one of the 3 witness statements had triggered. She forwarded the email to her personal address and went back to charting. At 4:40, Petra appeared beside her and said, very quietly, "There's a man at the front desk asking for you." Not a patient, not a relative. He said he was from legal. Nora had called the attorney, herself a woman named Sylvie Carver, who did medical employment cases and had been recommended to her 2 years ago by a colleague who'd needed her, and then, thankfully, hadn't. She'd called Sylvie from the parking lunch structure during her lunch break. She hadn't expected Sylvie to move this fast. It wasn't Sylvie. The man at the front desk was in his 50s, carrying a soft leather briefcase with the polished unhurried quality of someone accustomed to waiting in institutions for as long as was necessary. He introduced himself as Terence Mulhall, General Counsel for Harrow Peak Medical Center, and asked if she had a few minutes. She did not have a few minutes. She had patience. She told him so. "I understand," he said. "Would tomorrow morning before your shift be feasible? Depending on what you want to discuss. I want to make you aware," he said carefully, with the syntax of a man who'd chosen every word before he arrived, "that the hospital's legal team has become aware of certain documents pertaining to your employment history and your service record that may have bearing on the review board proceedings." He paused. "I want to ensure that you have appropriate representation before those proceedings and that you're aware of your rights under the hospital's employment policy." She looked at him for a moment. "Documents pertaining to your service record," which meant Greel, or someone adjacent to Greel, had moved faster than Bryn had estimated. Had surfaced the falsified record, the one that made her exit from military medicine look like a disciplinary matter rather than an institutional cover. Had placed it somewhere the hospital's legal team could find it, or had placed it directly with the hospital's legal team. "Thank you for the notice, Mr. Mole," she said. "I've already retained private counsel. Please route any communications to—" She gave him Sylvie Carver's office number, and "I'll be available through her going forward." He wrote the number down. He thanked her professionally. He left. She stood at the front desk for exactly 3 seconds. Then she called Sylvie Carver and told her what had just happened. Sylvie said, "When's the board?" "Wednesday, 9 a.m. I'll be there at 8. A pause, the sound of a woman already typing. "Nora, I need to know right now, is there anything in your service record that, taken at face value, would look like a pattern of insubordination or clinical overreach?" "At face value, yes." "Okay. And the reality?" "The reality is documented." "I have it. Physical documents?" "Physical and digital." "Cure location?" "Not in Arizona." "Can you get them here by tomorrow?" "Yes." "Get them here by tomorrow," Sylvie said. "And don't talk to anyone at that hospital without me present. Not HR, not legal, not Oakes, not Vrel. Nobody." "Understood." And Sylvie's voice shifted, became less attorney, briefly, more person. "Are you okay?" She thought about that honestly for a second. The way she did when she thought about the blood gas or the ventilator, actually assessed it, didn't reach for the easy answer. "I'm functional," she said. "That's something," Sylvie said, and hung up. She made one call that evening. Not to Bryn, she was keeping that line deliberately cold until she understood his full position, and not to Reyes, who needed sleep more than he needed another conversation. She called her sister in Portland, which she did approximately once a month, and which, tonight, served the double purpose of actual human contact and of having someone who wasn't in this hospital or in this situation know where things stood. Her sister, whose name was Dana and who was a landscape architect with 3 kids and a very different relationship to crisis, listened to the condensed version without interrupting. When Nora finished, Dana said, "So they're using your military record against you." "Someone is trying to. The same record you won't talk about." "Yes. Because of what happened. Because of what they said happened." Dana was quiet for a moment. "Are you going to fight it?" "I think I already am." "Good." A pause. "Are you sleeping?" "Some." "Eat something that isn't from a vending machine." "Try. Call me Thursday, Wednesday. Wednesday then." Another pause. "Nora, you know you did the right thing. In that trauma bay." She did know that. Knowing it hadn't made any of the subsequent 72 hours less complicated. But she knew it, and that was the thing she held on to when the rest of the calculation felt unresolvable. "Good night, Dana," she said. She slept 5 hours. Better than the night before. Wednesday arrived the way Wednesdays did in a hospital, without ceremony, without the dramatic build-up that the situation seemed to warrant. Nora was at Harrow Peak by 7:45. Sylvie Carver arrived at 8:10, a compact woman in her mid-40s with short gray-streaked hair and the particular economy of movement that came from spending a career in rooms where things were decided. They met in the hallway outside the conference room, and Sylvie reviewed the documents Nora had received overnight as a courier from Portland, the package that had been in storage for 5 years and had waited in a fireproof box in Dana's basement under 3 other boxes in a specific order that Nora had thought about with decreasing frequency as the years passed. Sylvie read for 12 minutes. She asked 4 questions. She put the documents in her briefcase. "This changes things significantly," she said. "I know. They're going to present the official service record as background context. Your pattern of clinical insubordination, framed through the military record, used to contextualize the incident report." Sylvie snapped the briefcase shut. "What they don't know is that the military record they have is falsified, and that you have the documentation to demonstrate that, and that there's an active investigation by a senior officer into the 7 instances of which your case is one. Brin's investigation isn't formal yet, but it exists. And the complaint that was buried still exists, because administrative burial isn't destruction." Sylvie looked at her. "When they present the record, we respond in kind. We don't wait for them to finish building the frame. We introduce your documentation, and we put the falsification question on the table directly. That's going to be uncomfortable for a lot of people in that room." "Yes," Sylvie said, "uncomfortable for them. Clarifying for you." She checked her watch. "Ready?" "Ready," Nora said. They walked in together. The room had expanded from the previous session. Oakes was in his same seat. Carol Stave, Whitfield from HR. Vrell, same position. Same folder. But something was different about his posture, today tighter, less settled. And across from Oakes, in the chair beside where Mole now sat, was a man Nora had not seen before. Early 60s, expensive suit, the deliberate stillness of someone exercising control over how much of himself he showed. She knew who he was before anyone introduced him. Howard Greele. She sat down. Sylvie sat beside her. Nora set her hands flat on the table and kept her face professionally neutral. Oakes began. He outlined the scope of the proceeding. From a standard incident review to an employment and conduct review, with the involvement of Tabor's oversight representative, whose role was advisory. Greele didn't say anything. He didn't need to. His presence in the room was already saying it for him. Mulhall presented first. He laid out the hospital's concern, a pattern of clinical overreach, supported by the incident in Trauma Bay 3 and contextualized by Nora's service record, which indicated a prior separation from military medicine under circumstances that involved disputes about clinical authority and scope of practice. He used the word pattern 4 times in 6 minutes. Vrell's folder was opened. He added his account, the same one she'd heard before, but with new language now, calmer, more clinical. The account of a physician concerned not about his own authority, but about a systemic issue that the hospital board needed to address. Greele hadn't moved. Oakes looked at Sylvie. "Counsel for Ms. Callum." Sylvie opened her briefcase. She placed 3 documents on the table. Then 3 more. Then a 4th set, each placed deliberately, with the particular patience of someone who knew she had more room to move in this conversation than the other side currently understood. "The service record that's been presented to this board," Sylvie said, "is a falsified document. Specifically, a field assessment report altered by a commanding medical officer to attribute patient outcome responsibility to a junior medic, Nora Callum, for what an independent senior officer at the time formally alleged was a command-level failure. She slid the first set of documents to Oakes. This is the original complaint filed with the Military Administrative Office at the time of Ms. Callum's separation. It was routed to an administrative dead end without resolution and without notification to the subject of the complaint, which is Ms. Callum. She slid the second set. This is Miss Callum's own contemporaneous documentation from the incident in question, maintained for 5 years, consistent with the senior officer's account and inconsistent with the official record. She slid the third set. And this is a preliminary summary of an active investigation by Commander Dale Bryn, U.S. Navy, which has identified 6 additional cases of altered field assessment reports from the same command structure, of which Ms. Callum's is the earliest. The room was very quiet. Oakes was reading. Carroll was reading. Even Whitfield had stopped typing. Vrell was looking at the table. Greal had not moved. But something around his eyes had changed. A subtle recalibration. The expression of a man who had arrived at this table believing he held a specific card and was now processing the information that the card had been identified and named before he'd played it. Mr. Greal, Sylvie said, and her voice was perfectly. I understand you're here in an advisory capacity as a board representative. I'd like to note for the record that the service documentation your office appears to have provided to the hospital's legal team was the falsified version, not the original. I'm curious whether that was an oversight. The silence in the room after she said it had a different texture than the previous one. I'm not sure what you're implying, Greal said. His voice was measured, calibrated. He'd done versions of this before. I'm implying that you provided a document that misrepresents Ms. Callum's military record to a proceeding designed to discipline her for performing a life-saving emergency procedure that your facility's attending physician failed to initiate. Sylvie looked at him directly. I'm not implying anything further at this stage, but I want the record to reflect that the question exists. Oakes put down the papers he was holding. He looked at Mole, then at Greal, then at Vrell. He took off his reading glasses and set them beside the papers. He was a man who'd been in institutional medicine for over 30 years. He'd sat in rooms like this before, but the expression on his face was the expression of a man who'd sat in those rooms and understood clearly, and, for perhaps the first time in this particular situation, that the thing he'd been told he was managing was not the thing he was actually managing. I need a recess, he said. 30 minutes. The room began to move. Greal stood. He was unhurried. He buttoned his jacket. He looked once at Nora, just once, the evaluating look of a man measuring something, and then he walked out. Nora sat still. Sylvie leaned over and said quietly, "You okay?" "Yes," Nora said. She was not fully okay, but the part of her that wasn't okay was a small and manageable part, and the part that had sat at this table with her original documents and watched 5 years of falsified record get named in a formal proceeding. That part was something she hadn't expected to feel, not triumph, which would have been too clean, but something closer to the sensation of a weight being carried so long it had started to feel like part of the body, and the first moment of understanding that it was possible to put it down. The recess lasted 41 minutes. When Oakes came back, Greal was not with him. Mulhall was. Carroll Stave was. Vrell came in last, 3 steps behind the others, with the particular quality of a man who had been in a hallway conversation that hadn't gone the way he'd needed it to. Oakes sat. He looked at Nora. The board has requested a full document review before any employment determination is made, he said. That review will include the materials presented today by your counsel, the service documentation, and the monitoring records from Trauma Bay 3. He paused. In the interim, Ms. Callum, you remain on regular assignment. No disciplinary action will be taken pending the outcome of the full review. He looked briefly at Mole. Mr. Greal has stepped back from direct involvement in this proceeding. Sylvie wrote something on her notepad. Nora said, "Thank you, Doctor." Oakes. He nodded once. He gathered his papers. He left. Vrell was still at the table. Everyone else had filed out, except Nora and Sylvie, who were collecting documents on their side. He sat with his folder closed in front of him and looked at the middle distance for a long moment, then looked at Nora. You've had that documentation for 5 years, he said. Yes. You came to this hospital knowing someone had access to a falsified record. I came to this hospital because I needed to work, she said simply. I didn't know about Greel specifically. I knew the record existed. I kept the rebuttal because I'm not careless. He was quiet for a moment. In the trauma bay, the airway. She waited. I was going to act, he said. Then, I don't know if that's true. I think I was going to act. He looked at his hands on the folder. I've been doing this for 19 years, and I don't know if I was going to act in time. It was the most honest thing she'd heard him say. She thought about several responses and chose the one that felt truest. It doesn't matter now, she said. He's alive. She picked up her documents and followed Sylvie out. She was at the nurse's station by 10:15, back on shift, because patients didn't pause for board proceedings, and the ICU's morning rhythm had continued without her for 2 hours and needed to be rejoined. Sylvie's had told her to expect a follow-up from the board by end of week and to contact her immediately if anyone at the hospital raised the issue outside of formal channels. Nora had nodded, thanked her, and gone back to work. At 11:30, she checked on Reyes. He was more awake than the day before, sitting up slightly, which she could see was costing him, but which he'd insisted on because lying flat made him feel incapacitated in a way he found professionally unacceptable. The chest tube output had decreased. His repeat imaging was scheduled for the afternoon. How'd it go? He said. Better than expected. Greel? He left the room before the recess ended. She checked his drain levels. Bryn's summary was useful. Bryn's always useful. He watched her work. He wants the documents, Nora. Your original assessment. It's the clearest single piece of evidence in the whole chain. I know, she adjusted the drain clamp. I'll decide about that after I understand what he's going to do with it. He's going to use it to correct the record. For you and 6 other people. I know what he says he's going to do with it. She looked at Reyes. I've been in systems long enough to know that what a person says they'll do with information and what they actually do with it can be different things. Even when they mean well. She held his gaze. Did you come here for me or for the investigation? He was quiet for a moment. A real moment, not an evasion, an actual pause of a man deciding whether to be entirely honest. Both, he said. Mostly you. She believed him. About the mostly. Get some sleep, she said. Your imaging's at 2. She was at the door when his monitor alarm went off. Not the soft advisory tone, the hard alarm, the one that meant something acute. She turned. His face had changed, the color leaving it in a way she recognized as sudden, not gradual, not the creeping pallor of slow deterioration, but the sharp drop of something happening fast. His blood pressure on the monitor read 84/52 and falling. Reyes. She was back at the bedside in 2 steps. Reyes, look at me. His eyes were open but glassy. Something's... I know. She hit the call button with one hand and reached for the drain line with the other. The output in the drainage chamber had changed in color and volume, darker, more, faster. Re-internal hemorrhage. The hemothorax they'd thought was draining and resolving was doing something else, or something new had opened, and it was moving fast. The slow morning had suggested it would. I need a crash cart and a surgeon in here now, she called through the door. Torres appeared, took one look at the monitor. I'll call vascular and thoracic simultaneously. Tell them active hemorrhage, post-trauma hemothorax, BP in the 80s, and dropping. She was already positioning Reyes flat, overriding his instinct to stay upright. Up was the wrong posture for this. Reyes, stay with me. Don't close your eyes. I'm not closing. He winced. Nora, I'm here. She pulled the IV line, checked the gauge, opened the flow. You're going to be okay. Don't make a liar out of me. Something that might have been a laugh moved across his face and immediately became a grimace. You always say that, because it's always been true. The alarm was still going. The corridor was filling with the sound of a hospital responding, the rapid organized motion of people coming from 3 directions with equipment. She kept her hand on his wrist and her eyes on the monitor and her mind on the 37 things she needed to do in the next 90 seconds in the correct sequence, Because this was the moment where sequence was the difference between the outcome going one way or the other. The thoracic surgeon was paged. Vascular was paged. The crash cart came through the door. And in the middle of managing all of it, the IV rates and the pressure and the drain output and the surgeon's ETA and the 4 questions the resident was asking, simultaneously, Nora became aware of another presence in the room. Not medical staff, not Torres or the respiratory therapist or the crash cart nurse. A woman she didn't recognize in a jacket that said Harrow Peak Administration on the left chest, standing in the doorway with a tablet and a very specific expression. Not the expression of someone who'd wandered into the wrong room. The expression of someone who'd come to this room specifically, who'd been looking for Nora and who had arrived at exactly the wrong moment and was now recalibrating what she'd intended to do. Because the situation in front of her was not what she'd expected to find. The woman looked at the monitor, looked at Reyes, looked at Nora's hands. Then she looked at the tablet in her own hands, and she started typing. The woman in the administration jacket didn't leave. That was the first thing Nora registered after the crash cart team moved in and the thoracic surgeon's resident arrived ahead of attending. The woman stayed in the doorway, tablet in hand, typing with the focused efficiency of someone documenting rather than observing. Nora filed it. There was no space to act on it yet. Because Ritz was on the table with a blood pressure that had dropped to 78/48 and was still moving in the wrong direction. And that was the only number that mattered for the next several minutes. The thoracic attending, Dr. Lena Forsyth, came through the door at a pace that told Nora she'd run part of the way from the surgical floor. She was 50s, efficient, with the no-preamble quality of a surgeon who'd stopped wasting words sometime in her second year of residency. "Talk to me," she said, pulling gloves. Post-trauma hemothorax, thought to be resolving. Drain output changed character 40 minutes ago, darker, increased volume. BP dropped acutely. No fever, no signs of infection. This looks mechanical. Nora moved aside to give Forsyth the primary position. Took blunt thoracic trauma in the overpass collapse. Rib fractures, left side, 3 through 6. The chest tube's been in since admission. Forsyth was already examining the drain, the tube site, running her hands with brisk precision along the left chest wall. "When did you notice the output change?" "Minute before the alarm." "I was in the room." "Lucky." Forsyth looked at the resident. "Get me an ultrasound now." She looked at the monitor. "And get 2 large-bore IVs if he doesn't already have them." "He has one," Nora said. "Left AC, 18 gauge." "Get a second." "Right side, 16 if you can." Forsyth was pulling the ultrasound probe before the machine had fully cleared the doorway. Placed it on Reyes's left chest with the practiced ease of someone who'd done this so many times it had become reflex. This image assembled on the screen, and even from where Nora was standing, she could see what Forsyth was seeing. A new fluid collection, larger than the drain was handling, with the density pattern of active hemorrhage rather than resolving old blood. "There's a bleeder," Forsyth said. It wasn't a question. She was already talking to the resident. "He needs to go to OR. Page thoracic. Tell them we're coming in 20. Get consent from," she glanced at the chart. "Next of kin is a sister in San Diego." "He's awake," Nora said. "He can consent." Reyes, who had been flat on the bed with his eyes, tracking the conversation with the effortful attention of a man who understood that comprehension was currently his most important contribution to his own survival, said, "I consent. Whatever you need to do." Forsyth looked at him briefly. "I need to open your chest." "Then open it. It's going to hurt afterward." "It hurts now." He found Nora's eyes for a half second. "Go do your job." She understood what he meant, not the shift. The other thing. She stepped back from the bed. The room was organized, controlled. Not smooth, because trauma rooms never were, but directed. The particular motion of people who knew their roles moving through them. Forsyth was managing it. The resident was competent. Torres was on the second IV. Nora looked at the doorway. The administration woman was still there. She'd stopped typing, but she hadn't left, and she was watching Nora with an expression that had shifted from the functional documentation face to something else, something that had more thought in it. Nora walked toward her. The woman took a small step back into the corridor, which gave Nora room to step out of the doorway and away from the immediate activity of the room. She was younger up close than she'd looked early 30s, with the over-precise grooming of someone who'd been trained to present a certain way and had internalized it. Her tablet was angled away from Nora's line of sight, which was a deliberate choice. "What are you documenting?" Nora said. "I'm from the administrator's office." I was asked to, "Which administrator?" A pause. "Doctor." "Oakes's office sent me to Dr. Oakes's office." Or Mr. Greel's office? The pause this time was longer, more textured. The woman looked at her tablet, then back at Nora, and the slight recalibration in her expression told Nora everything she needed. "You were sent here to document my behavior in a patient room," Nora said. Not accusatory, just the statement of a fact, offered plainly to see what the other person did with it. Someone wanted a record of how I handle myself with a specific patient. That patient. She tilted her head toward the room. "I was asked to conduct a routine welfare observations." "Is that what it's called?" Nora looked at the tablet. "I'm not going to ask you to show me what you've written, but I am going to tell you that in the last 20 minutes, you watched a nurse identify an acute hemorrhagic complication in a post-trauma patient, alert the appropriate team, assist with initial stabilization, and transfer care to the attending surgeon in an organized and clinically appropriate manner." She met the woman's eyes. "Document what you saw, not what you were sent to find." The woman held her gaze for a moment. Something moved through her expression, not quite guilt, but the cousin of it, the expression of someone who understands, for the first time, the gap between the thing they've been asked to do and the thing they should do. She typed something. She walked away without saying anything else. Nora watched her go. Then she went back to her assignment. Reyes was in the OR by 11:45. Forsyth later characterized the procedure as a contained intercostal artery bleed that had been slow enough to miss on initial imaging, but had accelerated possibly due to a rib fragment shifting during his second morning of recovery. It was the kind of complication that happened, that wasn't preventable with better initial care. That was simply the physics of what the overpass had done to his body, expressing itself on a slightly delayed schedule. The surgery took 2 hours and 14 minutes. Nora knew this because she checked twice during her shift. Not obsessively. So twice was not obsessive. Twice was the appropriate frequency for a nurse monitoring a situation she couldn't directly manage. He came out stable. She let out a breath she hadn't fully acknowledged holding and went to check on her other patients. The afternoon brought two things in sequence. The first was a call from Sylvie Carver at 1:50, delivered to Nora's personal cell during her break in the parking structure, because the break room felt too enclosed for this conversation. "The board's document review has already found something," Sylvie said. "I got a notification from Mole's office. Not a communication, just a notification that the timeline for review has been accelerated again." "To when?" "End of this week, right at the latest." Sylvie paused. "I think they found something in Greel's communications. Something that connected his office to the falsified record before it reached Mo Hall. That's my read based on how Mole's assistant phrased the notification." Nora stood in the parking structure with the Tucson heat pressing in from outside and thought about what that meant. If Greel's communication showed he had knowingly provided a falsified military record to influence an internal hospital proceeding, that wasn't an employment matter. That was something else. "Is this going to get referred somewhere?" she asked. "It might. Possibly the state licensing board, possibly further, depending on what they find." Sylvie's voice was careful. "You should know that Bryn called my office this morning. He'd found me through your record of retainer. He said to tell you that the formal complaint regarding the 7 altered field assessments has now been submitted through military legal channels. It went in yesterday afternoon. While she'd been sitting at the review board table watching Greel button his jacket. He moved fast, she said. He was ready before he came to Tucson, Sylvie said. He needed your documentation to complete the filing. Once you gave him the summary, I gave him a verbal account, not the documents. He said that was enough to file the preliminary complaint. The documents you have will strengthen it, but the complaint is in. A pause. Nora, this is moving quickly now. I want you to be prepared for the possibility that by Friday, the situation at Harrow Peak looks very different than it does today. Different how? The kind of different where people who were above you are below you, Sylvie said. And that transition isn't always graceful. After she hung up, Nora stood in the parking structure for another minute. She thought about graceful transitions and what they looked like in practice. In her experience, they didn't look graceful at all. They looked like people in rooms making decisions under pressure with incomplete information. And the outcomes were often better than expected, but rarely tidy. She went back upstairs. The second thing came at 3:20. She was at the nurse's station, halfway through a documentation update. He entered Carol's scene update when Carol Stay appeared with an expression that had moved past bad news being carefully carried into a new category she didn't have a word for. Something more complicated. Something that had Carol Stave, who had been a nurse manager for 14 years and had seen most things, but looking at Nora with an expression that was partly apologetic and partly something that resembled, if she was reading it, right relief. Walk with me, Carol said. They walked to the far end of the corridor, near the window that looked out over the parking structure. Philip Oakes asked me to tell you directly, Carol said. The document review that started this morning has been escalated to the hospital's board of governors. Not the advisory board, the full board. She paused. Greel sits on the advisory board. He does not sit on the board of governors. So this decision, going forward, will be made by people who don't have a prior relationship with him. What triggered the escalation? The administration assistant, who was sent to your floor this morning, filed her own report, Carol said. She documented what she'd been asked to do and who had asked her to do it. She submitted it to Oakes directly at about 1:15. The woman with the tablet, who had stood in the doorway and watched Nora manage Reyes's acute bleed with her face going through its recalibration. She went on record, Nora said. She went on record. Apparently she was told the observation was routine welfare documentation. When she realized the patient she was assigned to document your behavior with was someone you'd been flagged as knowing someone connected to the records being reviewed, she understood that wasn't a routine. Observation. Carol looked out the window for a moment. Her name is Kelsey Pratt. She's been in that office for 18 months. She's probably going to need to look for another position eventually, because people who go on record in situations like this tend to have complicated trajectories. But she filed it anyway. Nora thought about Kelsey Pratt for a moment. Young, precise grooming, a tablet angled away from view, standing in a doorway, watching something she hadn't expected to see, and then deciding what to do about it. Is Greel still in the building? She asked. He left at noon. I don't know if he's coming back. Carol turned from the window. I want to tell you something off the record. Okay. I reviewed your documentation from the Breck case. The airway, the procedure note, everything 2 days ago. Not for the board, not because I was asked to. On my own. She met Nora's gaze directly. That was the right call. Everything you did, in the right sequence, for the right reasons. I've been a nurse for 26 years, and I know what a clinical decision looks like versus what performance looks like, and what you did in that room was a clinical decision. She paused. I'm sorry it took a formal proceeding for that to be said. Nora held her gaze. Thank you. It wasn't a small thing. It wasn't the formal recognition, which was still pending. It was a nurse who'd been watching from a position of institutional obligation saying, with nothing to gain from it, that she'd seen it clearly. That mattered differently than a board decision. Not more, but differently. Get back to your patients, Carol said, sod. Not dismissive, just the language of two people who understood that work was the constant thread through everything else. Nora got back to her patients. At 5 o'clock, Marcus Vrell appeared on the third floor. This was unusual. His duties rarely brought him upstairs, and since the review board, he'd been conspicuously absent from the ICU's orbit, whether by choice or by someone else's suggestion. She didn't know. He came to the nurse's station, waited for her to finish what she was doing, and then said, "Can I have a few minutes? My shift ends at 7. I have patients until then." After 7, then. He said it without the authority he'd always used to frame those words. Just a statement. A request that acknowledged it was a request. She nodded. At 7:15, she found him in the corridor outside the physician's lounge. He was in street clothes. The shift had ended for him earlier, and without the white coat, he looked different in a way that wasn't just physical. He was a tall man, broad-shouldered, and he'd always used his physical presence the way he used his title, as part of the apparatus of authority. Without the coat, without the title currently attached to him in the way it had been 3 days ago, he looked like a man in a corridor who'd been waiting and wasn't entirely sure what would do with the waiting. She stopped a few feet away. "The Board of Governors is meeting Friday," he said. "I know. My ER supervising role has been suspended pending the outcome." He said it without effect, not performing composure and not performing distress. "Just the fact, stated. Oakes told me this afternoon." She waited. "I filed the incident report because I believed it was the appropriate institutional response." He looked at the floor for a moment, then back at her. "I also filed it because you made me look like I didn't know what I was doing. In front of residents. In front of Sadie Holt." He paused. "I'm not saying that's a good reason. I'm saying it was part of the reason, and I'm not going to tell you it wasn't." The honesty was unexpected. Not the content she'd suspected it, but the willingness to say it directly. "What do you want from this conversation?" she asked. "I don't want anything. I just stopped. Started differently. 19 years. I've been practicing emergency medicine for 19 years, and I have not once had someone step in front of me and do the thing I should have done in that way, in front of that many people." He said it like a man who'd been carrying the specific weight of it for 3 days and needed to set it somewhere. "The patient's name is Randall Breck. He's going to surgery tomorrow for the rod removal. He's going to make a full recovery. His wife came in this morning, and she asked who saved his life." He looked at her, told her the truth. That surprised her more than anything else. "Okay," she said. "That's all you're going to say? What do you want me to say?" He shook his head slightly. Not dismissal, something more like acknowledgement that he didn't have an answer to that. "I want you to know that I'm going to tell the board the same thing I told her." She held his gaze for a moment. He looked tired. Not the performed tiredness of someone managing optics, the actual fatigue of a man who'd spent 3 days reckoning with something he'd been able to avoid for a long time. "Get some sleep, Dr. Vrell," she said. She walked past him to the elevator. Thursday passed in the specific, suspended quality of days that exist between a thing that has happened and a thing that is about to happen. She worked her shift. She visited Reyes, who was out of the OR and back on the floor with a new chest tube and the irritable alertness of someone who found post-surgical recovery personally insulting. She spoke to Sylvie twice. She ate a meal that wasn't from a vending machine, which she'd promised Dana she would do, and it was a mediocre sandwich from the cafeteria that she ate at the nurse's station between patient assessments, and which tasted like exactly what it was. Bryn called her at 6 in the evening. "The preliminary complaint has been acknowledged," he said. "Military legal received it Wednesday. They've assigned an investigating officer." He paused. "Your documentation, the original field assessment, is going to be formally requested. I want you to know that before it happens, so you're not caught off guard." "When?" "Probably next week. It goes through Sylvie Carver's office, officially, and you have the option to provide it voluntarily or wait for the formal request. Either way, the outcome is the same, but voluntary is faster. I'll provide it voluntarily, she said. Okay. He was quiet for a moment. Reyes is going to be okay. I heard about the surgery. He's going to be fine. He's already complaining about the food. That's how you know. A pause the kind that had something in it. Nora, for what it's worth. What you did in that trauma bay the day the overpass collapsed. That was the first time I'd seen your work since Kandahar. You haven't lost anything. She sat with that for a second. Not basking in it, just receiving it honestly. Thank you for finding me, she said. Even if the timing was terrible. The timing was the overpass's fault, he said. Not mine. Good night, Bryn. Good night. She put the phone down. Outside the window of wherever she was standing, the break room, the same one where she'd brought Bryn the day he'd appeared in the lobby. The Tucson evening was doing what Tucson evenings did. The sky going from the hard daylight blue to something more complicated, deeper, the kind of sky that she'd looked at on and off for 3 years, without particularly registering it. She registered it now. She went home and slept 6 hours, which was, for her, essentially luxury. Friday arrived. The Board of Governors meeting was not something she attended. It was not structured for that. It was an executive proceeding, not a hearing, and neither she nor Sylvie was present in the room. What Sylvie had told her to expect was a determination by end of business, and what Nora had told herself was that she would do her shift and wait and not anticipate, because anticipating outcomes she couldn't control was the least efficient use of the cognitive space she had available. She did her shift. She was in the middle of a medication reconciliation on bed 7 when Sylvie's name appeared on her phone at 2:43 in the afternoon. She stepped into the supply alcove. It's done, Sylvie said. Nora waited. Marcus Vrell has been removed from his emergency supervisory role. Formal determination, pattern of clinical negligence, documented staff mistreatment, and misuse of hospital incident reporting processes. Sylvie's voice was measured, but there was something underneath the measure that wasn't quite lawyer, something more human. His clinical privileges remain intact for the time being, but he's been moved to a non-supervisory position, pending a mandatory professional review that will take at minimum 6 months. And Greel referred to the State Health Authority's Board Oversight Division. The full findings of the document review, including the falsified record, the manner in which it entered the hospital's legal proceedings, and the surveillance tasking of Kelsey Pratt, have been formally submitted. A pause. He's going to resign from the advisory board before the end of the day. His legal team contacted the hospital's general counsel at noon. They're negotiating the terms. The supply alcove was very quiet. Someone in the hallway was saying something about a family meeting on bed 3. The ventilator on bed 6 was doing its steady rhythmic work. And my incident report? Nora said, dismissed in full. The board's determination explicitly states that the actions taken by Nora Callum in Trauma Bay 3 on September 14th were consistent with the standard of care and clinical responsibility appropriate to a nurse with her. Documented training and experience. Sylvie paused again. They used the word exemplary. Nora leaned against the supply shelf. She pressed her back flat against it, the way she'd stood against the wall in the conference room. 3 days ago, after leaving Vrell, and she took a breath that went all the way in, for the first time. Since she counted back since the moment she'd walked into Trauma Bay 3 and seen Ranzal Breck's face going the wrong color. Okay, she said. That's all? What else should I say? Most people cry, Sylvie said, or they say something more substantial than okay. I'm at work, Nora said. I have patience. You always have patience. Yes, she said. I do. I'll send the formal determination to your email. The board also wants to schedule a meeting with you next week about your position here going forward. They use the phrase role clarification, which, in my experience, usually means they want to offer you something. Think about it. Think fast. They tend to interpret thinking time as negotiating posture. Let them interpret what they want, Nora said. I know what I want. What do you want? She looked out through the supply alcove door at the ICU at the nurse's station, with its accumulated charts and coffee cups, at the monitor bank with its 12 screens, at Torres walking past with a medication tray, at the curtain of bed 11, where Reyes was presumably arguing with someone about his mobility restrictions. To go back to work, she said. She went back to work. At 4:15, she was charting at the station when she heard Vrel's voice in the corridor. Not loud, not the voice he'd used in rounds or in the conference room, just a normal voice, talking to a resident about a case being transferred from the ER to the ICU. He came around the corner and saw her. They looked at each other for a moment. Then he walked to the chart she was working on, glanced at the name, and said, "The transfer coming up is a 44-year-old post-surgical right iliac vascular repair. He's going to need close monitoring on the pressure side. The repair was technically successful, but the surgeon is watching for restenosis." "Understood," she said. "I'll have him assigned to a room with a continuous arterial line." He nodded. He started to walk away. Then he stopped and turned back, and the expression on his face was the most human she'd seen it. Not comfortable, not resolved, just a variety at something difficult, and was making himself stay with it long enough to say it. "I told the board this morning that the incident report should not have been filed," he said. "I told them that my characterization of your actions was wrong, and that I filed it for the wrong reasons." He looked at her steadily. "I want you to know I told them that, not because it changes the outcome at this point, but because you should know it was said." She held his gaze. She thought about what Reyes had said the first morning. Be careful. About what you think you know and what you can prove. About Bryn, about the 7 cases, about 5 years of a falsified document, sitting in a fireproof box in her sister's basement in Portland. About Randall Breck, who would have a scar below his jaw for the rest of his life, and was alive to have it. "Thank you," she said, "for saying it." He left. She went back to the chart. At 5:30, Reyes's room was on her pass. She pushed the curtain aside. He was sitting up, fully upright, which the surgeon had apparently cleared him for this afternoon. And he was reading something on his phone, or pretending to read something, because when she came in, he put the phone down with the speed of a man who'd been watching the door. "The board met," he said. "You have a source inside the board?" "I have Bryn." He shrugged carefully, monitoring his own pain level as he did it. So she said. "Vrel, removed from supervision. Mandatory review. Greel, referred to the State Oversight Board. Resigning from the advisory position. Your status?" "Cleared." She picked up his chart, checked the drain output, flipped to the nursing notes. "Surgery tomorrow for the rod removal. That's Breck, not you. You're looking at 5 more days minimum before discharge. Forsyth wants another imaging series on Monday. 5 days." He said it the way someone said 5 years. "Your ribs need time. My ribs are fine. Your ribs have 3 fractures and a recent surgical repair. They feel fine." She looked at him over the chart. "Reyes." "I know," he said. 5 days. He looked at the ceiling for a moment. "Nora, what I told you about Decker and the fundraiser and Greel, about the documentation, all of that. It's in motion," she said. "Bryn filed the preliminary complaint Wednesday. The military's assigned an investigating officer. My original assessment is going to be formally requested." Something in his face shifted, not relief exactly, but the expression of a man whose particular weight is being recognized and handled by people who know what it is. "You're going to give it to them?" "Yes." "Good." He looked at his hands. "It shouldn't have taken this long. Any of it." "No," she said. "It shouldn't have." There was a silence that was neither uncomfortable nor easy, just honest. The silence of 2 people who had been through something extreme, separately and now partially together, and who were currently sitting in its aftermath without trying to narrate it into something cleaner than it was. "I need to finish my rounds," she said. "Go." She was at the curtain when he said, "Hey." She turned. I came here for the right reasons, he said. Mostly. She almost smiled. I know. She went back to the floor. At 6:40, 20 minutes before the end of her shift, Nora was standing at the nurse's station, completing her final documentation when Carol Stave appeared. And this time her expression had reached a category Nora hadn't seen on Carol's face before. Uncomplicated. The board's formal letter came through to my office, Carol said. The full version. I wanted you to see it before you left tonight. She handed Nora a single printed page. She read it. It was 3 paragraphs, formal language, board resolution structure, and it said, in that language, what Sylvie had summarized over the phone. But it also said something else, some paragraph, in the 3rd paragraph, that Sylvie hadn't mentioned or that had been added after their call. The board was recommending, pending Nora's agreement, the creation of a new staff position, emergency clinical resource nurse, a senior designation that would place her in a formal advisory role on mass casualty protocols and emergency nursing procedure standards across all Harrow Peak departments. Not just her unit, all departments. She read the paragraph twice. They want to make official what you already do, Carol said. That's essentially what it is. She put the letter down on the desk. She thought about what Sylvie had said. They want to offer you something, and about what she'd said back, that she'd think about it, that she knew what she wanted. She had thought, saying that what she wanted was to keep working her floor, keep her patients, keep the life she'd built inside this hospital that was complicated and sometimes hostile and also real, the realest version of professional life she'd had since the version that had ended in a way she hadn't chosen. She still wanted that. But the letter in front of her was offering something different. Not a replacement for the work and expansion of it. The authority formally given to do what she'd been doing without it for 3 years and what she'd done in Trauma Bay 3 without waiting for it. She looked at Carol. I need a few days to think. Take the weekend, Carol said. They're expecting an answer Monday. Nora folded the letter. She put it in her scrub pocket. She finished her documentation, signed off her patients to the evening nurse, and collected her things from her locker. In the parking structure, the day's heat was releasing into the early evening, and the sky above the concrete levels was doing the Tucson thing, again, going colors it didn't have words for. The kind of sky that only existed in desert places where there was enough dust in the air to catch the light and turn it into something that didn't belong in a city. She sat in her car for a moment. She took out her phone. Not to call anyone, just held it. Then she took out the folded letter from her pocket and read the 3rd paragraph one more time. She was still reading it when her phone buzzed with a message from a number she didn't recognize, different from Bryn's number, different from any number she had logged. Arizona area code, but not Tucson. Phoenix, maybe. The message was 4 words. We need to talk. And then, after a pause of maybe 30 seconds, a second message from the same number. A name she knew, not from Harrow Peak, not from Tucson, not from any chapter of her life that existed on this side of the distance she'd built. A name from before, the name of the senior officer who had filed the original complaint 5 years ago, the complaint that had been buried, the complaint that was now the foundation of Bryn's formal case, the complaint that had never been resolved because the person who'd filed it had, according to everything Nora had been able to find out over 5 years of careful, infrequent searching, disappeared into a reassignment that effectively made her unfindable. Commander Iris Weld. Nora stared at the screen. The parking structure was quiet around her. Somewhere below, the ER entrance was probably doing what ER entrances did at this hour: ambulances, families, the ordinary emergencies that filled the gap between one crisis and the next. Randall Breck was on a floor above her, preparing for tomorrow's surgery, alive. Elliot Reyes was in bed 11, arguing with a nurse about mobility. Marcus Vrell was somewhere in this building, carrying the specific weight of a man who'd made the wrong call and had, for once, said so. Howard Greel was somewhere in Phoenix with the legal team, negotiating a resignation. And Nora Callum was sitting in a parking structure in Tucson, holding a phone with a message from a woman she hadn't heard from in 5 years and hadn't known was findable, who apparently knew her number and had reached out in the same hour the board's formal letter had arrived. She typed back, when and where. The response came in 11 seconds. Tomorrow. I'm already in Tucson. She didn't sleep much that night. Not from anxiety. She'd moved past that register, somewhere, in the last 4 days, and what she felt now was closer to the particular alertness of a person standing at the edge of something that had been in motion for a long time and was finally visibly arriving. She lay in the dark and thought about Iris Weld, about the last time she'd seen her a corridor in a military medical facility 5 years ago, 2 days before Nora had signed her separation paperwork. Weld had been in uniform, walking fast in the opposite direction, and they'd made eye contact for less than 2 seconds. Weld's expression had said everything that the institutional situation prevented her from saying. It's out loud. I tried. I'm still trying. I'm sorry this is how it landed. Nora had nodded. She'd kept walking. She'd assumed, in the years since, that Weld had eventually given up on the complaint, that the bureaucratic burial had done what bureaucratic burials were designed to do, not destroy, just lost. The person filing the complaint eventually runs out of the particular fuel required to keep pushing against a system that offers no friction, no response, just absorption. Apparently, she'd been wrong about that. She got up at 5:30, made real coffee, and sat at her kitchen table with the folded board letter and her phone and the morning quiet until it was a reasonable hour to be somewhere. Iris Weld had chosen a diner on the eastern side of Tucson, the kind of place that had been in the same location for 30 years, and showed it, with laminate menus and a counter that still had spinning stools, and a Saturday morning crowd that was mostly retirees, and one table of college students who'd clearly not yet been to bed. Nora arrived at 8. Weld was already there. She was smaller than Nora remembered, which was always the way memory expanded people, gave them the size of what they'd meant to you rather than their actual dimensions. She was in her early 50s, civilian clothes, short silver hair that had been dark the last time Nora had seen it. She was sitting with both hands around a coffee cup, and she stood when Nora came through the door, which was the gesture of someone who'd been uncertain whether the other person would actually show. Callum, she said. Commander Weld. Iris, she said. I've been out of uniform for 2 years. They sat. The waitress came. They ordered the same thing, coffee, eggs, the breakfast of 2 people who weren't here for the food. Weld looked at her for a moment, with the careful attention of someone taking an inventory. You look the same, Weld said, except your eyes are different. Different how? Like someone who's been somewhere difficult and figured out how to be okay with that. She wrapped both hands around her cup again. I know about this week, about the board decision, about Greel. A pause. Bryn keeps me informed. He keeps everyone informed, Nora said, on a need-to-know basis that he defines. Something like a smile moved across Weld's face. Yes, that's exactly right. She looked down at her coffee. I want to explain why I disappeared. You don't have to. I want to. She looked up. After I filed the complaint, I was reassigned. Technically, it was a promotion senior medical advisory position, desk work, Washington. In practice, it was the classic move. Take the person making noise and put them somewhere the noise can't travel. She said it without bitterness. Just the flat clarity of someone who'd processed the anger and come out the other side into something more functional. I didn't stop. I kept the documentation, kept the file, kept trying to route it through channels that weren't controlled by the same people who'd buried the original. It took 2 years to find Bryn, another year to convince him the file was complete enough to act on. She paused. By the time we were ready to move, I needed to find you. Bryn found me. Bryn found you, because I told him where to look. She held Nora's gaze. Your sister, Dana. She still has the same firm website she had 7 years ago. I found her. I asked Bryn to use his channels instead of reaching out directly, because I wasn't sure you'd want to hear from me. After everything, Nora thought about Dana's firm website, the landscape architecture practice that Dana had built over 15 years, and which she'd never thought to ask Dana to take down or scrub or make private, because it hadn't occurred to her that someone looking for her would route through her sister's professional life. You filed the original complaint on my behalf, Nora said. I filed it because what happened was wrong, Weld said. Not as a favor to you, because the record was falsified, and 3 other medics were operating under similar pressures, and someone needed to say so officially. She set down her cup. I know that doesn't change what it cost you. Nora thought about 5 years. About Harrow Peak and the particular life she'd built there. Not the life she'd wanted, maybe, but real, substantial, filled with patients who needed her and work that mattered, and a version of herself she'd assembled from the parts that survived the exit from military medicine. It hadn't been a waiting room. It had been a life. It didn't only cost me, she said. I learned things here that I wouldn't have learned anywhere else. She meant it. Not as consolation, not as reframing, just the actual truth as she assessed it. I'm a better nurse than I was 5 years ago. Weld looked at her steadily. You were already exceptional. I was fast and trained and effective, Nora said. That's not the same thing. She picked up her coffee. What happens now with the complaint? The investigating officer is Rear Admiral Patricia Suno. She's thorough, and she's not connected to the original command structure. The preliminary filing covers 7 cases. With your original assessment added, the documentation is complete. Weld's voice had shifted into the register she probably used in professional contexts, precise, composed, the voice of someone presenting a case she'd been building for years. The commanding medical officer who falsified the reports retired 18 months ago. He's still subject to the investigation. The referral will go to the Military Inspector General's office. That process takes time, probably 18 months to 2 years before any formal determination, but it goes. And the record. Your official service record will be corrected as part of the investigation. The falsified field assessment will be formally annotated, and the original complaint will be entered into the administrative file. She paused. It won't look like it never happened, but it will look like what it actually was. The eggs arrived. They ate in the specific silence of 2 people who had said the important things and were now existing alongside each other without needing to fill the space. After a while, Weld said, "What are you going to do?" About the position the board offered. You know about that too, Bryn. Nora shook her head slowly, not irritated, just resigned to the particular efficiency of Dale Bryn's information network. I've been thinking about it since last night. And I think I'm going to take it. She said it as she was still deciding, which was essentially accurate, the decision solidifying as the words came out. Not because it's an apology from the hospital. They're offering it because they looked at the mass-casualty event and the trauma bay and the documentation and decided that having someone with my background in a formal advisory role is useful to them. She looked at her plate. That's fine. I can be useful, and useful can also be what I want. Those aren't mutually exclusive. Weld was quiet for a moment. That's a mature way to think about it. I'm tired of being romantic about institutions, Nora said. They do what they do for their own reasons. The question is whether what they're doing aligns with something you care about. She looked up. Training emergency nurses in crisis medicine. Developing mass casualty protocols. Working with doctors who haven't dealt with what happens when 30 people come through the door at once. She paused. That matters. The way it gets structured doesn't have to be perfect for the work to matter. Weld smiled. Not the brief, functional movement from earlier, something more genuine. The smile of a woman who recognized something she'd been hoping to find. Good, she said simply. They finished breakfast. They split the check. Outside the diner, in the Saturday morning light that was already working toward the day's heat, they stood on the sidewalk for a moment. I'm sorry it took this long, Weld said. I know. Nora looked at her. Thank you for not stopping. It was the truest thing she had. Weld had filed a complaint that had cost her a comfortable trajectory, had been reassigned and absorbed into institutional silence, and had kept working anyway, through channels that offered no guarantee and no timeline, for 5 years. That wasn't nothing. That was, in fact, exact the kind of thing that never got recognized, because it happened in the spaces between the visible events, in the slow, quiet work of people who believed the record should be accurate even when no one was watching. They shook hands. Weld walked to a car parked half a block down. Nora stood on the sidewalk for a moment, watching the Tucson morning move around her, a couple walking a dog, a truck making a delivery, the ordinary Saturday motion of a city that didn't know what had happened inside one of its hospitals this week and didn't need to. She walked to her car and drove back to Harrow Peak. Not because she was scheduled, because there was someone she wanted to check on before the day moved forward. Randall Breck's rod removal surgery had been scheduled for 9 a.m. She found him in the pre-surgical holding area at 8:40, lying in the bed with the particular stillness of someone who'd been told not to move and was applying his full concentration to not moving. His wife, a compact woman named Tessa, who'd been at the hospital every day since the overpass collapse, was in the chair beside him with her hand over his. He saw Nora in the doorway, and something in his face changed recognition, but more than recognition. The expression of a man who had been told a specific thing and was now seeing it in person for the first time. That's her, Tessa said quietly to him, which meant she'd been told too. Nora came in. She introduced herself fully, first name, last name, her role. Breck looked at her for a moment. He was big, even lying down, with the broad hands of someone who'd done physical work his whole life, and the steel rod was gone now, removed during a preliminary procedure 2 days earlier, leaving a bandaged site along his jaw that would scar but cleanly. Vrel told my wife, he said, about what happened in the trauma bay. I heard he did. She'd heard from Carol, who'd heard from the surgical coordinator, the information traveling the way hospital information always did, laterally, informally, faster than official channels. She cried, he said. I didn't, but it was close. He held her gaze. I don't know how to thank you for something like that. You don't need to, she said. Get through this surgery. Then go home. That's it? That's it. She smiled at him, a real one, not the professional comfort smile, the actual one. You've got work to do too. Healing is work. Don't let anyone tell you it isn't. His wife Tessa made a sound that might have been a laugh, turned into something else partway through. She reached out and put her hand briefly on Nora's arm. Just a touch, a second, the gesture of someone who had more to say than the situation allowed for. Nora thanked them. She left them to the surgery prep and walked back through the hospital. She found Ray sitting up in bed 11. At 9:15, attempting to convince the weekend nurse that he was cleared for a short walk to the window. The weekend nurse, a young man named Flores, who had the patient but implacable quality of someone who'd had this specific argument before, was explaining that the mobility order didn't cover unsupervised ambulation, and that if he wanted to go to the window, he needed to wait for the physical therapist. Nora stood in the doorway and watched this exchange for a moment. He's right, she told Reyes. Wait for the PT. Reyes looked at her with the expression of a man being outnumbered on a point he was already losing. You could just walk me to the window. I could. I won't. She came in, checked his drain, output still decreasing. The trajectory was good, and pulled the chair. I met with Weld this morning. His attention sharpened immediately. How is she? Good. Serious. She's been working on this for 5 years without stopping. I know. I found out about 6 months ago. Before Decker and the fundraiser. He looked at his hands. She's the reason the complaint has any traction. I found the Greel connection. Bryn built the structure, but Weld did the foundational work. She said the same thing about Bryn. That's because they both did the foundational work. He glanced up. The investigating officer is Suno. Patricia Suno. He nodded slowly. That's a good assignment. She doesn't move fast, but she moves correctly. He was quiet for a moment. It's going to take time, Nora. The formal correction of your record, the determination about the CCO who filed the false report. It doesn't happen next week. I know, but it happens. Yes, she said. It happens. She stood. Your imaging is Monday. Forsythe's reviewing it herself. If the intercostal repair looks clean, she'll probably clear you for discharge Tuesday. 5 days, he said, the same tone as before. 4 now. 4. He looked at the window, the morning light coming through it, the particular southwest morning light that was different from every other kind, white and unfiltered and relentless. What did you decide? About the board's offer. I'm taking it. He was quiet for a moment. Then, good. You don't think it's mine? It's right, he said. You're not someone who should be invisible. You were making yourself invisible because the situation required it and because you're practical. The situation changed. He looked at her. Take the room. She almost asked what he meant. She knew what he meant. Get some rest, she said. She left. Monday morning, she submitted her formal acceptance to the board's offer in writing through Sylvie Carver's office, with 3 conditions: that her existing patient assignments be transitioned gradually rather than immediately, that the new role include a direct reporting line to the ER director rather than through the department's administrative structure, and that the protocol development component begin with a formal assessment of the hospital's existing mass-casualty response framework before any new training was designed. All 3 conditions were accepted by end of day. The formal appointment letter arrived Tuesday. Her name, her new title, Emergency Clinical Resource Nurse, Harrow Peak Medical Center, and a start date 3 weeks out to allow for the patient transition. She read it at the nurse's station on the 3rd floor ICU, standing up, the way she read everything, and then she folded it and put it in her scrub pocket and went to check on bed 6. Vrel's formal professional review began the 2nd week of October. She didn't follow it in detail. It wasn't her proceeding, and the specifics weren't relevant to her work. What she knew was what Carol told her, that he'd submitted a voluntary statement acknowledging the incident report had been retaliatory, that the review board was examining 3 prior cases in which staff complaints about his conduct had been filed and not acted upon, and that the outcome would likely result in a permanent restructuring of his role rather than reinstatement to the ER supervisory position he'd held. He was still in the building. She saw him occasionally in the elevator, in the cafeteria, passing in the corridor. He looked like someone who was doing the work of rebuilding something from a point much lower than where he'd started, which was difficult and probably necessary, and not something she felt the need to comment on. Howard Greel resigned from the advisory board the Monday after the board meeting, as Sylvie had predicted. The state health authority's formal investigation opened 3 weeks later. She didn't expect it to move quickly. She'd stopped expecting things to move quickly. She expected them to move correctly, which was a different standard, and by that standard, they were moving. Kelsey Pratt, the administration assistant who'd filed the internal report, had been quietly moved to a different department. Not ideally, not perfectly, but she was still employed, and her report was part of the formal record, and that was better than what many people got for doing the right thing when it was inconvenient. Reyes was discharged on a Wednesday. She wasn't on shift that day, but she came in anyway, not in scrubs, just herself, in regular clothes, which felt strange in the way that being in a hospital out of uniform always felt strange, like wearing the building's context without the credential. He was dressed and sitting on the edge of the bed when she arrived, his go-bag on the chair, Flores doing the final discharge paperwork at the door. He looked depleted in the specific way of someone who'd had their body opened and repaired and needed 2 months of careful rest to fully come back from it. He also looked like himself, which was its own kind of reassurance. "Where are you going?" she asked. "San Diego, my sister." He made a face. She's going to feed me soup for a month. Good. You need it. I need it like I need a second chest tube. Reyes. She held his gaze. Thank you. For coming here. For what you found and what you did with it. He looked at her for a long moment. The morning light from the window was doing the same thing it had been doing when she had last sat with him. White, direct, the kind of light that didn't flatter anything but made everything visible. You would have found it yourself eventually, he said. Maybe. Not this fast. Fast matters, he said, in medicine and everything else. She walked him to the elevator. She waited while it came. When the doors opened, he got in, turned to face her, and said, You know where to find me if the investigation needs anything else. I know. And Nora. He held the doors for one moment. Don't shrink it down again, whatever you do next. Don't make yourself small so the room feels more comfortable. She thought about that, about 3 years of calibrated invisibility, about the particular discipline of being good at your work and keeping that goodness at a volume that didn't threaten anyone, about all the clinical judgments she'd filed rather than voiced, and all the moments she'd swallowed, because the cost of being right out loud seemed higher than the cost of being right quietly. I won't, she said. The doors closed. She stood in the hallway for a moment. Then she went home, because she wasn't on shift, and she'd promised Dana she'd call, and she had a new role starting in 3 weeks that needed preparation. She hadn't started yet. And there were things that were finished and things that were beginning. And the only way to tell the difference was to be honest about which was which. She called Dana from her kitchen table. How are you? Dana said. Better, Nora said. Actually better. Not the functional version. A pause. She could hear one of Dana's kids in the background, the particular shriek of a child who's discovered something worth shouting about. What changed? A lot. I'll tell you all of it. She looked out the window. The Tucson afternoon. The light going at the particular angle it went in October, when the summer heat had finally relented and the sky was something you could look at directly. I took the position. The advisory thing? Yes. Good, Dana said. It's about time someone gave you a room that fits you. Nora thought about what Reyes had said in the elevator take the room and what Dana was saying now, and how they were saying the same thing in different language, which was the thing about people who knew you and said it anyway because they believed you needed to hear it. I need to tell you something, Nora said. Okay. The box. In your basement. I'm going to need you to ship it back. She paused. Not because I'm hiding it anymore. Because it belongs with me now. Dana was quiet for a moment. I'll send it Monday. Thank you. It's your history, Nora, Dana said. It was always yours. You were just storing it somewhere safe while you figured out what to do with it. She sat with that after they hung up. Sat with the kitchen quiet and the afternoon light and the particular feeling of a week that had dismantled something she'd spent years building around herself and left her, unexpectedly, not diminished, but clearer. Like a window that had been filmed with dust being cleaned. Not transformed, not replaced. Just finally showing what had always been behind it. She was not the nurse she'd been 3 years ago when she'd walked into Harrow Peak as a person with a buried past and a very specific set of instructions to herself about how much space to take up. She was the nurse who had stood at the head of a table with a scalpel in her hands while a man's oxygen level fell, and had made the only choice the situation offered, and had then spent a week defending that choice to people who had the authority to punish her for it, and hadn't finally been able to. She was the nurse who had kept 5 years of original documentation in a fireproof box in her sister's basement, because she had known, without being able to act on it yet, that the record was wrong and that records could be corrected if you kept the proof long enough. She was the person Iris Weld had filed a complaint for, and the person Dale Bryn had driven to Tucson to find, and the person Elliot Reyes had crossed 3 states to reach before the overpass interrupted the plan. And she was the person who had, in the end, been none of those things primarily had been, first and most essentially, A nurse who saw a man dying and did the thing that needed doing without authorization and without a guarantee because waiting was the only option she couldn't live with. That was the whole story. Not the board decision, not the formal letter, not the title change. Those were consequences. The story was the decision in the trauma bay, made in the time it took to pull on a glove, in the full knowledge of what it would cost, because the cost of not making it was someone's life. Institutions eventually caught up to that. Sometimes they did it gracefully, usually they didn't. The catching up, the Katzensen, wasn't the point. The point was what you did in the moment before anyone was watching, when the only person who knew what the right thing was you. She got up from the table, made coffee, opened her laptop, and began reading about mass-casualty protocol frameworks, because she had a new role in 3 weeks, and she intended to walk into it having already done the homework, because that was who she was, and there was no longer any good reason to pretend otherwise. The evening settled around her. Outside, Tansan was doing what it did, the lights coming on across the valley, the sky going from orange to the deep blue-black that didn't look like anywhere else, the city's ordinary nighttime machinery starting its rotation. She worked until 10. She went to bed. She slept 8 hours, which was for Nora Callum, a thing that hadn't happened in longer than she could accurately calculate. And in the morning, she got up, put on her scrubs, and went back to work. Not because the fight was over. It wasn't. The investigation would take months. Vrel's review would take longer. The 7 falsified records would take years to fully correct, and the people they'd affected would carry the damage of them even after the documents were amended, because that was what institutional harm did. It outlasted its own correction. But she went back because the work was real and the patients were real, and the difference showing up and not showing up was the difference between someone being seen and someone being invisible. And she had been invisible for long enough to know exactly what that cost. The elevator opened on the 3rd floor. She stepped out, clipped her badge, and walked into the ICU. The morning shift was starting. Somewhere down the hall, a monitor was beeping its steady rhythm. A family was waiting in the consultation room. A resident was asking a question that needed answering. Nora Callum walked toward the work. She didn't hide what she was. Not anymore.